Good morning and good afternoon. I hope everyone can hear us. We are going to start our day 3 of the conference. We're starting the side event 1, which will be hosted by StartSpeak. And it's about innovative application of GIS in climate and health research. We have several speakers on this today, and this session will be co-chaired by Ms. Janita Kisembo, also a project manager from StartSpeak. So welcome once again, and I hope that today will be enjoyable and have a meaningful and discussion just like day 1 and day 2. So I just want to confirm if Ms. Janita is with us so that I can give the mantle to her to introduce the team and kick off the discussion.
All right. Good morning. Thank you, Ezekiel. Yes, I'm with you. And I believe majority of the team is here. Unfortunately, Dr. Anthony won't be able to join us today. He had a last-minute engagement, but the rest of the team is here and we can proceed. So I'll introduce myself. I'm Janita Kisembo. I'm a project manager with StartSpeak, and we are basically a data and software company. With me today, we have a few other panelists, and let me give them a chance to introduce themselves too. Over to you, Naomi. Naomi, I don't know if you can hear us, or Dr. Kirigo.
Sorry, I was speaking on mute. Again, this is Naomi. My name is Naomi Mohio from Dalberg Research. I'm a geomatic engineer and I work in the location analytics department, and I'm happy to be here with you. Back to you.
All right. Thank you, Naomi. Over to you, Kirigo. You're also here with us.
Hello, good morning. So I'm Kirigo Ashira. I'm a DIC by profession and also in the climate and health space. I work for Ishara Africa as their sustainability lead and their climate and health advisor. And I'm excited to hear as we explore this discussion. Thank you.
All right. Thank you, Naomi. Over to you, Derek, if you can hear us.
Hello, everyone. I hope you can hear me. My apologies. Unfortunately, I'm out in the field. I had some work that I had to do, but I hope you can all hear the sound. So my name is Derek. I'm a geospatial engineer by training, and I am also a software developer. Sorry. So I do a lot of geospatial analysis and software development along different geospatial applications. So part of it is on health, and done projects particularly on health. One is on the neglected diseases, particularly snake bites, and I'm also doing an application for menopause. So yes, thank you.
All right, thank you very much, Derek. Unfortunately, Liz also has an engagement. She'll be able to join us later on in this discussion. So I guess we can get started. First of all, thank you so much for giving us the opportunity to be a part of these discussions and this conference in general, and to also share our input based off the work that you're currently doing. So just to get us started, we all know from the past few days, or even previously in our experience from the work that we do, that, you know, obviously climate continues to shape our environment, communities, and health outcomes. Therefore, it's our responsibility to harness every tool and address these challenges. And in particular, today we'll be talking about geospatial information systems, or GIS, and how we can apply this to climate and health related, you know, research and applications in Africa in general. So also, it's not, you know, foreign to us that Africa is unique in biodiversity and cultural heritage, but it's also for its exposure to a spectrum of, you know, climate-related risks and also health-related risks across the continent. So people in, I would say, mostly rural and underserved communities are especially vulnerable to these risks. They face extreme weather events like droughts, floods, and I know the Kenyans here can talk about the recent floods we had, you know, a while back, and how that affected many people and their access to healthcare, or the several disease outbreaks that, you know, of course, were brought about by the flood. Amongst other things, you know, heat waves, shifting patterns of diseases, whether in, you know, humans or animals, among many, many other things. So these factors obviously place immense pressure on our health systems, which often lack data and resources needed to respond to this effectively. And StatsPeak being a data company, we want to capitalize on layering our data, putting the geographical aspect of data on our health data sets that we have, so we can be able to effectively pinpoint communities or areas where different climate changes might pose, you know, different health risks. And of course, in this context, building resilient health systems that can withstand and adapt to these environmental shifts is crucial. And yet again, we've seen traditional health strategies often fall short. Why, you may ask? Because of lack of localized data across cross-sector collaboration required to address these complex interconnected challenges. And this is exactly why GIS and spatial data technologies come into play. So today's discussion, I believe, is going to be focused on how can we, from different backgrounds that are all interconnected, come together and harness the power of the data that we have, derive meaningful insights that can then help us navigate the different risks that we may face, either in climate or health, or together. I believe we would definitely talk about, you know, the potential of GIS in climate and health research, and also the applications of GIS in climate and health resilience. And we can break this down into different, you know, sections that can be maybe disease surveillance and prediction. It can be disaster preparedness and response, and resource allocation and infrastructure planning, health equity and social determinants, but also, most importantly, maybe even more important than the others, policy and decision making. How does, you know, the use of GIS help us make more informed decisions, but also create that shift in policy making? So without any further ado, I think we can pass it over to Dr. Kirigo, if you can hear us, so you can also share from your point of view and expertise how GIS can be applied for better outcomes in health and climate.
So thank you very much, Juanita. You've laid the ground quite well. And so I hope you can hear me right.
Yes, we can hear you.
Oh, okay, thank you. And first and foremost is to appreciate your inclusion, your intentional and meaningful inclusion of the youth. I come here representing the youth in the spirit of the Gen Zs, and you can see, and from the discussions, you'll get to see how we are contributing to the climate and health discussions, the actual work that we are doing, and I believe we are going to learn from each other. So one may think, why public health and GIS? And this spans from way back. We all know Hippocrates, who is the father of medicine. And in a research that he did on air, water, and places, this is a quote or just a summation of what he had to say. In order to understand any health issues, it helps to understand the geographical determinants of the health issues. So in relation to climate change, the climatic determinants of these issues are key for us to understand the health issues or the health impacts that we are receiving from climate change. So moving on, I'd want to bring us into the context of where the climate and health discussions have spanned from. We all know COP26, where we had the first climate and health resolutions, and WHO enacted ATACH, that is Alliance for the ATACH deals with the climate and health. They are trying to work on the commitments that came out of the COP26, which are mainly on climate resilient health systems and sustainably low carbon health systems. So under the climate resilient health systems, we have three main objectives that all the parties that signed the commitment are supposed to be doing. And this is where my discussion comes in. That is on conducting, one, they need to conduct vulnerability and adaptation assessments. That is on climate change and health, which are then supposed to guide us on developing healthy national adaptation plans. And also the healthy national adaptation plans should then guide us on how to access funds and how to acquire these funds for the projects that we aim to do in climate and health. So taking you back to the vulnerability and adaptation assessment, what are we doing? What is being done and how is GIS coming into place? One, there's a document by the WHO called the WHO Framework on Climate Resilient and Low Carbon Health Systems. And under that, it guides on how to conduct the VNA assessments, that's the vulnerability and adaptation assessments. And they also have the documents that will guide us on that. One, we have a checklist, and we have another guiding document on VNA assessments. And on that, several countries in Africa have managed to conduct their VNA assessment. And I'm proud of Uganda, which are already done with the assessment, and they've developed the HNAP. And how is GIS coming in? So of the 6 steps that the vulnerability assessment is tackling, 3 of them involve GIS, that is the mapping. One is in identification of these vulnerable geographical areas as well as the vulnerable populations. So we can pick that as one. Number 2 is on assessing the capacities of our health facilities. They've used the GIS to map out the health facilities that are in those geographical areas that are quite at risk. Number 3 is on the future risk assessment, just to try and project where are these trends shifting to, what do we expect? And so GIS is coming in handy in guiding us to conduct these VNA assessments, which are the baseline and the building block if we have to take any action in climate and health. So with that, I think I can take it back to Joanita to guide us. Thank you.
All right. Thank you so much, Dr. Kiriko, for that wonderful input. And there are a few messages in the chat, but I believe we'll definitely get to that later. And right now we can give it over to Naomi, if you can hear us.
I can hear you, Joanita, and thank you for this opportunity, and thank you, Dr. Kirigo, for that good perspective that you've given us. And following on to that, what I'd like to discuss is evidence. Dr. Kirigo has spoken about the different aspects and the interconnectedness of GIS in relation to health. But now what I'd like to discuss is evidence and evidence-based analysis when it comes to the nexus between climate and health. And I'd like to pick two examples just to guide the discussion, and that would be energy as well as food security. Global warming is not new to anyone. We all know what that is, and we know the biggest contributors is the GHG, that is the greenhouse gases. Carbon dioxide is one of the main ones. And we know that is a problem. We know we need to solve that. And I think a majority of people know that the first proposal to want to reduce emissions and we want to increase sequestration would be we need more vegetation. But when we do this, we need to give solutions that are very practical, because one of the easiest things to do and to say would be let's plant trees everywhere. We're going to sequester all the carbon, but we have to analyze first why do we not have this kind of vegetation in the first place. Number one would be encroachment due to need for agricultural land. But that does not mean just because people want to farm, it now will compromise climate. No, we need to now be able to implement sustainable soil management practices, because soil is one of the biggest carbon sinks that we have. And when we look at Africa as a continent, approximately 40% of our land is agricultural land. And that is land that we need to sustain ourselves in terms of food security, but also we need to be able to implement techniques that will help us to boost productivity for the sake of the community health, but also to help sequester carbon. And so one of the inputs of GIS is being able to target. We know, sure, 40% of land is agricultural, but where are these parcels? What type of vegetation is here? What are the challenges that these, let's say, farmers or pastoralists are facing, so that as we propose measures, they will be very specific and targeted to whatever environment that is. Because you cannot make, you can make a bracket assumption. We know what are some of the challenges that face us in face agricultural lands or farmers, but they are very unique problems. And so GIS will help us with the use of secondary data, and of course supplementing that with primary data. And it's one of the areas that would need better collaboration, because especially when you find places that are more remote and less accessible, it's difficult sometimes to define interventions that would help these kinds of environment, not because this data is not there, but because this data is not accessible. So it's being able to properly document these data sources. So if it's a case of data collection by local stakeholders, being able to utilize GIS tools, for instance, Survey 123, to be able to have this data in a way that it can be used by other stakeholders, let's say in the climate sector, in the health sector, to be able to come up with solutions for the same. Another example would be energy, and we know another contributor. We've spoken to agriculture. Agriculture would help us with the sequestration, but then now there's a emission, and the biggest is industrialization. We know our energy sector. Again, this has been mentioned again in the previous sessions that we've had. Is are one of the biggest contributors of pollution. And we have one of the green energy sources such as solar and wind. And we know that Africa has great potential for solar energy. But now when I talk about evidence and data-backed proposals and initiatives, it would be important, it is important as we look at these things, to be, again, very specific in terms of, yes, we know we have higher levels of GHI, but we need, again, to analyze our land use. We need to know where is this applicable, so that even as we look we look at, for instance, funding for these kinds of projects, we would know that we are proposing evidence-backed analysis to be able to resolve this. And again, this would also, when we talk now about transdisciplinarity, this is why it's important, because what I have discussed this far has been especially climate heavy, but the focus of this conference is a nexus between climate and health. Malnutrition is one of the challenges that obviously would result in terms of as a result of food insecurity. But then now, if we have health experts, they're able to collaborate with the GI experts to know what aspects of health do we need to analyze to be able to measure the health of a community. What variables do we need to pick? For instance, let's say we want to look at maternal health. What are some of the tangible indicators can we pick and be able to map and pinpoint the problem areas that then would need to be addressed? So those are some of the applications that are with heading GIS that are that show the interconnectedness of climate and health. Back to you, Joanne.
All right, thank you so much, Naomi, for that insightful input. And I like how obviously you're emphasizing, collaboration between different disciplines to bring, about actual change. Because if everyone stays with their expertise and you're not collaborating, it obviously makes it hard for impactful change to happen. So moving on, we'll have Derek Ongeri give us his input on the application of GIS in climate and health. Derek, if you can hear us.
Yes, I can hear you. Just confirm that you can hear me.
Yes, we can hear you loud and clear.
Okay, thank you. So I think as all the other previous speakers have mentioned, there's a very there's a very deep relationship between, let's say, climate and health, and a lot of things that affect health. I'll just speak from like a practical example. 3 years back, we were doing epidemiological sampling, and we had a team of doctors looking at particularly snake bites and antivenoms. So they wanted to see how to see treatment and prevalence, and this is on the northern side of Kenya, that is mostly Tanzania and Kano. So these two areas are greatly affected by adverse climate conditions, particularly drought and sometimes extreme floods. So one thing that I noticed is while we were to build a capacity, because of that lack of collaboration and preparation, when they went to do the epidemiological sampling with the traditional methods without any form of data, they couldn't really manage it on the field and they couldn't reach the community. So as GIS experts came in to try and rapidly do a near real-time mapping of all households, particularly focusing on the urban areas, the peri-urban areas, and the rural areas. Now, this is a mobile population, and you would understand one of the reasons why they are moving is particularly in search of pasture and water. So you realize all these variables are being variables are controlled by the climate. So before we actually set out for the field, we did some rapid mapping and then validation of all the households and a proportionate sample from the population, depending on the different strata was collected. And you will realize that when we went to the field, there was a huge success in terms of reaching the population. And then also while there, we discovered some of the things that actually affects the access to health, particularly climate, because find a child and then before they can actually take the education, the community to move into a different area. And all this is because of the impact of some of climate change, extreme health population, aside from other factors. So really, I think the implications are not really successful because you realize that the treatment patterns, some of the factors that influence access to either healthcare and also the prevalence of some diseases and treatment are actually dependent on different communities which settle on different areas of place. You need to map this out and we need to understand. So currently, after the mapping and the application and everything, the interventions that happen to the place and the ongoing projects right there gets the community and also equip some of the medical as a result of all the geospatial insights that we gain. So for me, I think that is one of the really critical areas where geospatial technology should be applied. I mean, I apply geospatial technologies in a lot of fields, but particularly for health, I feel like it's the most impactful and really touches on the community. So thank you, and back to you.
Well, thank you, Derek. And obviously, I'm mentioning that you're also a software engineer / developer. From your expert opinion, how do you think AI can be put to use to bring out the best the best in these efforts of connecting health and climate using GIS?
Right now we are in a age where there's a lot of data. There's a lot of data. There's a lot of data climate. And we also have a lot of data prevalence. One critical area
So sorry to jump in.
Unfortunately, you're breaking.
Yes.
Oh, sorry. Just confirm that you can hear me. Can you hear me?
Yes, I can hear you now. I don't know if Ezekiel and the rest of the team can hear you.
Yeah, it's clear. Then it goes away. I don't know. The network is not stable, but just try.
Oh, sorry. Yeah. Yeah, but I was just saying there's a lot of data, particularly on climate. There's a lot of data on land. There's a lot of satellite data. And I could even think initially we had a lot of troubles, like supervised classifications of household patterns and
Sorry, Derek. Sorry, Derek.
Yes.
It's not clear. I
Okay.
cannot seem to get. But maybe if I could suggest that you do some input in the chat, would be insightful as well.
Thank you. And then I think I will just type my input on that on the chat.
I think that will be best.
Okay.
All right. Dr. Annan is asking if we can show a practical case. Let me see if I can pull something and if it's actually possible to share this data, and then I'll just share my screen once I have it. In the meantime, I don't know if Liz has been able to join us. Not yet. So I'll just have someone from my team, either Edna or Antoinette or Anne, also obviously share their input based off the few projects they've been working on recently. I don't know if you guys can hear us, Antoinette or Edna or Anne.
Okay, before they come in, Janita, maybe let me jump in just to clarify on a few areas that already some wonderful presentation insights from your team. And I also echo the same sentiments that practical case examples would be very meaningful at this case to put 1 into 2 and able to understand this topic much deeper. GIS is a practical and also professional expertise that if we need to explain to local communities will require, if not synthesized in a simplified manner, will require a lot of understanding to someone to understand. But just echoing the previous speakers from Janita to Kirigo and Naomi and Derek, even though Derek's case was not a little bit clearer, but all echoing the importance of applying GIS in this manner. So as I'm going to reiterate what they have said on the use of GIS, as ARIN as well, we incorporate this and we try to show this in our side event yesterday on the use of GIS in some of the projects that we undertake. But this still comes back to what are some of the data sources that we are using. Maybe when the case studies are going to come in, maybe the Janita team would like to point out to some of the data sources. What are some of the accuracies that you might derive from those data sources? And does this also hamper or hinder our work when it comes to analysis using GIS? And if so, what are we doing so that we can able to reiterate this or move past this to ensure that the quality of work that we produce is at par or even more excellent in that respect, depending on the project that we are involved in. When we talk about the collaboration with the communities or the local vulnerable groups, does these accuracies or data sources also help in getting the required accuracies that we need? Because, for example, Derek talked about satellite data, and satellite data sometimes have resolutions that may not go to the world level sometimes. So what do we have to do when we have such difficulties, and how to hamper them? Otherwise, this conversation has been very meaningful, and I just want to urge our participants, do not be left out if you hear something that is more technical. I urge that if you have any questions, just put it on the chat. If you have a chance to raise your hand, you can also go ahead once the case studies have been presented to pose a question to the panel so that they can deliberate and give us more insight of the same. But as well, you can you're welcome to use the chat box to air out any questions that you may have. Thank you, and I'm going to invite back Janita. I hope the team is ready with the case studies.
Juanita, that is over to you. I don't know what you have next in line, but I do have an example in mind of maybe a short presentation that I can make just to show a use case example where climatic data has been used to help address community related challenges. But happy to follow your lead, Juanita.
Yeah, sure. Sorry, I was on mute. You can share first. I also have a short presentation, but yeah, you go ahead and then I'll share mine right after you.
All right. Let me know you can see my screen. Can you see my screen, and can you hear me?
Yes, the screen is visible. Yes.
Okay, all right. So again, this I think is going to help answer two questions, because someone has asked a question on the use of AI and also example of data sets that we've used. So here is an example that we've leveraged climatic and biophysical data to help curb the challenge of food insecurity and again related health challenges to that. I don't think I need to go into that. And we have an example of Kenya. So here we took case maize as a case example to analyze. We know maize and other derivatives like ugali and whatnot is a staple for these settings. And what we can see is some of the climatic challenges like we have addressed earlier, and now specifically facing maize production. We have climatic challenges such as rain, and also we have other economic challenges such as fertilizer and cost of fertilizer, and also the type of fertilizer that you have. So we have the approach that we used is machine learning and specifically a prediction algorithm, where initially we selected a training data set that we were going to feed into the model. Some of the technologies, there are different technologies that you can use, and for this one specifically we used R to run these predictions along other GIS tools. There are many that you can use, but just to mention, you can use QGIS, you can use ArcGIS, which is a licensed software, but for someone maybe who doesn't have access to that, you can use QGIS. Once we identified the training data set, then the next step was to define the dependents or the variables or the drivers that affect production, which then we fed into the training models, and then we did a prediction, and then we did an accuracy assessment. And what I have spoken about, the environmental and biophysical variables, is what you can see down here. What contributes, what affects maize production or yields. When we talk about biophysical variables, we are talking things about the vegetation index. This is the leaf area vegetation index. There are others that you can use depending on your use case. For example, the normalized difference vegetation index. It's slightly different from the leaf area index, and the application would depend on what you want to achieve. Now we have land cover. Again, I mentioned land cover when I was speaking about assessment of solar energy potential or assessing agricultural land. Now, this specific use case for this one was to be able to define what areas are viable for maize production in Kenya. Then soil carbon content. Soil carbon content speaks to soil health, and again, by extension, potential to produce, then altitude, and those are biophysical factors. And then we talk about climatic factors, is precipitation and temperature. So those are the variables that we fed into our model. So here is just an explanation of what some of those variables are, which I have covered in the previous slide, so I will not dwell on this. And then now, here is here's the output that we had from our analysis. We see that we can have an additional an additional 4 million hectares of land is feasible for maize production in Kenya based on the climatic and biophysical factors in those areas. So on the map on the left side of the slide, we can see yellow, and those are the areas that have existing maize production, areas that maize is already being grown, and the green is areas that now are viable for additional production of maize. So this is the output, and this is the additional land that can be used for maize production. And that would actually increase maize production by 8 million metric tons. Now, there's the variables that we spoke into, or the GIS data that fed into this. Now, on the right-hand side, here is what we have on the model accuracy assessment. Just to give perspective, is this is again the accuracy level of this prediction that we did here. And on the variable importance plot, this shows based on the data that we used and the model that we ran into. This is a correlation analysis. How much do these indicators affect production? And the indicators on the top, that is temperature, precipitation, leaf area index. Those are the variables with the highest effect on maize production. And then when we go down, we have elevation as one of the indicators that has, it's important, it affects the productivity of land, but it's not as important as, say, precipitation and temperature would be. And I think this can already be seen from this map, and especially if you're familiar with the landscape of Kenya, you'd be able to tell these are the lowlands, these are the places that are already growing, and also these are the highlands regions of Kenya. So this is just a short presentation that I wanted to share with you to give perspective of what we are talking about. Over to you, Jonita, and also I'm happy to respond to any questions that anyone may have.
All right, thank you so much, Naomi. So I see Ezekiel, you look like you want to say something. So I was wondering if we should give both presentations and then welcome questions, or if we can give the audience a chance to jump in with any questions they might have on this particular one.
I think we can give the audience a chance to jump in case somebody raised their hand, so that, because I know they might forget the question they want to ask, but if that's not the case, they can always just put it on the chat and we pick it and we can summarize as well. But I was just going to do a follow-up, maybe just to prompt the audience maybe on the questions as well. I can see Naomi's presentation is well done. But some of the questions that come top of my head will be these data sources that we mentioned: temperature, rainfall, leaf area index. What are some of the data sources where you're getting this data, and what is the accuracy, and does that hamper the model preparation?
Okay, all right. A majority of the climatic data sets we've used is satellite imagery from various sources. You can refer to various sources, but for instance, one of a good source for this kind of data is a Food and Agricultural Organization. They have this data at varying resolution. You can have this at 100 meters, you can have a kilometer, and it's not, of course, but I mean, it's the one that comes to mind. You can resample this to what you need, but those are some of the sources that we get this data from. Soil carbon content, one of the resources I have personally found useful for this is the ISRIC. They have good data on soil carbon, and again, you would be selecting the kind of data you want. Let me speak specifically to soil carbon based on your use. And this is by what you want, I mean various soil depths, because the quantity of soil carbon is going to vary based on the depth that you're analyzing.
Okay, excellent. So maybe we can proceed with other case studies, then maybe for the next 7 minutes before we wrap up.
I don't know if you can see my screen.
Yeah.
Yes. Yes.
You can see my screen?
Yes.
All right. So this is a project that we're working on as StatSpeak, amongst others. I just wanted to pick one that could clearly show the intersection of GIS and AI and how we actually used it in real life, on a real life project during a real life crisis. So as you can see, it's a flood response data-driven approach. And this was during the recent floods. And from this slide, we can see that the application of GIS and, well, layered with geographical data, layered with other forms of data, maybe from DHIS, OpenStreet, etc. Because we have population, we have healthcare data, we have road networks, we have county, we have etc. Loads of data. So we can see the number of households that were affected. we can see the deaths, and this was real-time updates. This data was, well, updated in real time. We can see affected health.
Sorry,
Sorry?
Janita, maybe you could put it in the presentation mode to be more
Oh,
clear.
you can. Okay, sure. Sorry.
This down, this presentation was just down.
Can you see it? No?
Yes, I can see it.
Okay. Is this better than before? Hi, Ezekiel, can you hear me?
Yes, I can hear you. Maybe you can just proceed. I think this is okay.
Okay, all right, sure. Better?
Yes.
Okay, all right. So as we can see here, we're leveraging GIS and AI for effective flood response. And as Naomi had mentioned before, this is a combination of different layers of data. We have health data from the HIS, we have census, for example, for population, we have road networks, we have county data, etc. And just at a glance, whoever we're trying to inform with these dashboards that we created by layering all that data can be able to filter. As you can see here, they can filter by county, and then it would give them the information from that particular county. But the most important information you can see just displayed, like affected households, affected male population, female population, casualties, dead, people missing, injured, healthcare facilities affected, amongst others. So when you move on to this slide, I think this just further elaborates on how GIS was used for real-time data collection. And of course, as you can see, you can filter down to different counties or different towns or different cities, and you'll be able to get a summary of the data you're looking for. For example, number of dead, number of missing, number of injured, etc. And because, of course, the floods were a climate-related problem, and it affected health care access in different counties, this was particularly to help decision makers figure out who is affected the most and how exactly they're affected and how can we help them, or what are the predictions of people who are probably going to be affected in the next couple of days. When we move on here, we can see that we have a flood AI, and this is something that we created, a chat DB, which is like a chat database. And what this was basically, we have a database where all this data was put, and whoever needed to access this data, say, for example, someone is in Nakuru, I'm giving an example, at a certain healthcare facility, by just typing in using natural language, they can be able to identify, say, number of mothers who have been affected by floods, and what this means. Have they been able to access antenatal care since they've been affected by floods? If you are displaced, what's the nearest healthcare facility they can go to? And what this did was to inform how resources were distributed. So instead of sending, say, 20 kids to a healthcare facility that's already submerged or is already flooded, you then channel your resources to either a rescue center that has been put up or a healthcare center that's within that area that mothers can then access to continue the antenatal care. In the same spirit, someone could also, you could use this data for so many things. For example, the population living with HIV, because of the floods, if, for example, they've been displaced, or if the healthcare facility they were getting the medication from unfortunately has been flooded and is not operational anymore, what's the nearest place they can go to continue their care? So, sorry, as you can see here, this is an example of how anyone can interact with this particular AI product. You could just, if you look to where the pointer is here, you could just type in how many pregnant women have been affected by floods, or which group of people have been affected most, and which counties have reported the highest numbers. And then from the data, which has been pulled from various sources, you can easily see, you can easily see the counties that have been affected the most, and then therefore as a decision maker or someone who's in a position to impact change, you know where to concentrate your efforts. Oh yeah, and then obviously last but not least, it's very important even as you collect data and layer this data, say health and climate, it's also very important to not only analyze it and say put it in a chart or put it on a map or put it in a graph. What does that mean to the layman? What key actions can be derived from this data? So from all these things that we do, at the end of the day, we come down and give recommendations or key action points. And these are not just action points based off what we think is right. These action points are based off what the data says and what, of course, the best course of action would be in that case. Yeah, I guess that's it. I don't know if I used the 7 minutes effectively.
Yeah, that was really, that's perfect. I can see some interesting comments on the chats as well. I'll invite Naomi just to respond on the chat as well, since that time is also running out. And somebody's inquiring about maize as well, which Naomi was talking about. How can we determine the factors that determine these factors affecting? I don't know whether the question is framed correctly, but Naomi can come in on the chat and respond to that. Also, somebody is noting on interesting GIS, AI, and emerging responses as per your presentation, which was actually good in terms of expressing that as well. Again, it looks like a one-stop shop for everything, that if you're there, you just don't need anything else. You get all the information there as a decision maker, just the same way you said it. There's also a question that is directed, maybe one of the team could answer this on the chat as well, or maybe I think, because I think there's only 8 minutes remaining before we do closing remarks. But the question is, the critical issue is attribution of climatic elements to the health and wellness of people. And so asking who can address that. And finally, somebody's asking if this AI that you have presented are available for all of us, or it's an in-house thing.
Oh, sorry.
Yeah, I think that's it. The last comment was just happy to join the call. So maybe those are.
So this is to Muhereza Duncan asking about the AI. So how we structure this, being a data company, data and software company, depending on the needs of our clients, we obviously tailor this product to the databases that you're looking at, and also what your end result is, your desired end result or objective is. So the answer would be yes and no. Yeah, it's available once someone is collaborating with us and they've given us access to that data and we've had the conversation about their objectives. And the answer is no, because if this product is a product that we've made specifically, as you saw that one, specifically for that client who wanted flood, emergency response, then unfortunately it can't be of help to you because it's connected to that particular data. Yeah.
So maybe I can call on say Yanita just for the closing remarks. I don't know whether Naomi is still on the call to answer on the chat. I cannot see if the answer is there, but maybe as you do the closing remarks, you'll be able to answer the 2 questions that are pending on the chat. Janita?
Naomi is here, so
Yeah, Ezekiel,
yes.
I'm responding to the question.
All right.
I don't know whether you want me to voice it over, because the first step, Julius, thank you for the question, would be to carry out research to determine the optimal conditions necessary for maize growth. For instance, the ideal precipitation level, the ideal temperature, and some of the other climatic variables that I have presented, for instance, in my example. Then once you have that data, then now what you need to do is actually collect what are now the actual values that you have in your area, be it temperature, precipitation, leaf area index, which this data sets, this is secondary data that you can find from some of the sources that I have mentioned, for instance, the Food and Agriculture Organization. And also, then now when you have that data for what now those specific values are for your area and compare that to the ideals, then you're able to pinpoint what are some of the things that you may need to address for optimal production. I hope that has answered your question.
All right. Thank you, Naomi. So I think just closing remarks from StatsPeak and all the panelists and the amazing audience we've had today is the only path forward is collaboration and innovation. And I believe both are extremely important, because if you're innovating and you're not collaborating with other people from different disciplines that could also impact health and climate, then it kind of ceases to be of use. So I believe it's very important to foster partnerships and invest in, GIS and AI technologies. And I believe by doing that, we can build, adaptive, sustainable healthcare systems, and also, be prepared for climate changes as they come. Maybe over to Naomi and Dr. Kirigo, if they have something, a parting word for the audience.
As Dr. Kirigo comes in, there's a last question for you as well on initiative to protect the hospitals from climate change effects. So maybe as you do the closing, have that in mind.
Okay, thank you so much. That has been an insightful discussion. With Medics, we are learning a lot from the GIS team. And as the conference theme has been, transdisciplinary approach is the new gold. Collaboration is everything in this. We cannot do without the Met department, without the medical department, without the statistical department. And the last but not least is the communities that are being impacted by this. You cannot enact any change, any law, any advocacy work without actual involvement of the communities. So that would be my closing remark on the collaboration and the transdisciplinary approach. And then moving on to Makale's question, what are we doing in our hospitals? How are the hospitals prepared? As I had mentioned earlier on the VNA assessment that we are conducting, step number 4 on capacity assessment handles the 6 building blocks of the healthcare systems. That is the healthcare workforce, the governance and leadership, the WASH, the infrastructure, the information system, the financing. We are evaluating all that to just see how susceptible are our hospitals. Then from there, can we get priority areas? Where do we need to focus on our finances for our hospitals? And on the same note, we are doing a lot of advocacy to our healthcare workers on climate and health, because this is the greatest threat to human health in the 21st century. Thank you so much. It was a great pleasure learning and contributing to this. Thank you.
Okay. Once again, thank you participants for joining this wonderful side event, person of day 3, taking your time and steering and helping in the conversation as they are going on. Maybe what I encourage is maybe our panel would share their contacts or their emails on the chat, so that anybody who will have to carry the conversation forward can able to reach out to them, so that they can the conversation is never stopping here, but going on. And even as we try to seek further collaborations, this could be the avenues and shares of doing so. I'll encourage the participants as well not to leave the call, because we just have a 30 minutes break before the second side event starts at 12:30. So just welcome you for the second side event that will also be on the transdisciplinary research and solutions for climate and mental health. I think that's also a powerful and a good topic to indulge ourselves into. So I encourage everyone to stay, and in the meantime, as you eat, grab a tea or a snack to re-energize. The call will remain open. You can choose just to mute and wait for 12:30, or if you choose to step out and come back again, that is still okay. But I'll just urge you to still remain for the second side event, which after that, there'll be another 30 minutes break before we go to the main plenary session that will also be starting from 2 p.m. The second side event is a 1 hour event, just the same as this one. So just to prepare us mentally on what to foresee in this day 3. And I still project that the discussion in the afternoon will still be impactful. So whether you are here now, we remain at 12:30, I encourage you to remain for the whole day for having that impactful discussion. Thank you once again, and this has been a very good and an impactful discussion. See you soon.
All right, thank you so much, Ezekiel and team, and thank you, everyone.
Thank you.
Research opportunities and solutions for climate and mental health. And without further ado, let me introduce the speakers, starting with Dr. Pamela Nkirote, Dr. Lydia Gashahi, Dr. David Luganda, Dr. Desaid Mabumbo, Dr. Hannah Ndongo. You're all welcome, and maybe you can proceed. Dr. Pamela.
Okay, good morning and good afternoon from wherever you are listening to this conference. I hope I am being heard. Can you confirm kindly?
Yes, we can hear you.
Wow, great. We are privileged as African Coalition of Communities Responsive to Climate Change to have to host this event with a great honor by ARIN, and we truly appreciate. As you have pointed out, the challenges of climate change transcend just the physical health to also the psychological health issues that concern our people. And so this, for me on this side is morning, because I speak from the USA. I traveled for a conference at the Yale University, which should be starting in a short while. So I am here to moderate this session. I'm privileged to have a wealth of experts on board who will be introducing themselves. Let me ask us to introduce ourselves as a team briefly, then we can kick off. Dr. Lydia.
Good morning and good evening, wherever you are in this continent and the world. I'm Lydia Gashahe. I'm a lecturer at the Technical University of Kenya and a leader in the Center for Integrated Water Resources Management. I have a background in climate sciences and a long studying in education of environmental sciences. Thank you.
Thank you, Dr. Lydia. Can we have Dr. Hannah?
Yes, thank you so much. My name is Dr. Hannah Ndongo, and working with ADRA Africa. ADRA is an Adventist Development Relief Agency, and therefore my work as a sociologist and also a leader, I deal a lot with community work in different countries in Africa and beyond. And I'm happy to be part of this to share the experiences of what we are doing within programming and also humanitarian responses and the effects of the community they face concerning mental health because of the diverse disasters that are happening. So thank you so much.
Great. David, are you in the house?
I'm David Luganda. I'm the coordinator of the Network of Climate Journalists in the Greater Horn of Africa. My work is mainly on science communication and dissemination of science products, and also fundraising for a number of organizations. Thank you. Right now, I'm in Kampala, in Uganda.
Dr. Decide?
Okay, thank you very much. My name is Decide Mabumbo. I'm a senior researcher on climate risk management and disaster resilience. I work for the International Water Management Institute. I'm based in South Africa, their Southern African office, and we are involved in quite a number of interdisciplinary research that covers both physical and mental health risks related to climate change. Thank you.
Great. Having had a feel of who is in the house, let me introduce African Coalition of Communities Responsive to Climate Change, which is NGO that is a regional NGO for Africa, but registered in Nairobi. ACRCC was able to identify the gap on the response in the light of health related to climate change, and especially the gap in response to mental health issues. And we are currently undertaking a study in sub-Saharan Africa that is looking at the countries Kenya, Uganda, and Ethiopia to get data that speaks to the nexus between climate change, food insecurity, and mental health. ACRCC is basically strong in advocacy, trying to advocate for mental health issues to be included in climate response, because the populations, the people that we serve, are bearing the brunt of climate extremes, and psychologically they are being affected. And it was found out that it is important that this area also be captured because of the trauma that is affecting our people. We have a lot of resources on our website, www.accrcc.org, and also on our LinkedIn social medias that is accessible to us. So, as I have alluded to, climate change and health are so deeply intertwined, with each of them intensifying the impact of the other. So addressing this connectedness requires an integrated approach that is able to draw from various disciplines to bring in the environmental science, public health, the economics, the social sciences, and even beyond, a transdisciplinary approach actually. And of course, research is very, very important because data informs interventions. So we need to be able to have researches that will bridge this interdisciplinary gap, so that then we transcend the silos that have existed in research. So today we'll be hearing from our experts to be able to understand what are the obstacles, and then how can we be able to navigate this complex landscape, so that then we discuss the importance of looking at these angles from a transdisciplinary approach, and even front forward, having a goal that we can explore better ways to support research, so that it transcends the boundaries that exist, so that we can be able to drive and give solutions to to the real issues that are affecting our people. So the team that has just introduced themselves will be able to help us identify and create a common goal that recognizes the national, regional, and also the global transdisciplinary approach to climate and health that is able to recognize the importance of the current education systems and also guide us to how to address these gaps. So to take us further, allow me to bring on board Dr. Linda Gachai, who is going to speak to us on how, as a keynote address, to help us and understand how can we be able to move forward, what are the gaps that exist, what are the challenges, and how can we be able to move forward. Dr. Gachai.
Thank you, Dr. Pamela Kaituru, for that introduction. I'm invited in this arena, and I am very glad to have been a member of this very useful conference. I have been here since the day it started, and I've gained a lot. I've had a lot, and I'm sure that this is going to take us far. Now, I am invited here to give an overview of the nexus between climate change and mental health. First of all, I would like to unpack climate change and look at it from what is it that is affecting us. When we talk climate change, it looks like one thing that is affecting the world, but when we unpack it, we will start to see what is it that is affecting you in your region, because what affects one region may be very different from what is affecting the other region, but all of them are coming from the climate. So since human history, we will say, climate has been oscillating around a mean state, and there has also been variabilities that has affected the people over time. El Ninos and La Ninas have not started today. They started, they are as old as the human history. But what is affecting us today is the frequency of the extremes that we have been receiving. And apart from the frequencies, a change of patterns, the patterns that we know. And this is why, this is what is making even communities vulnerable, because communities are used to some mean state of climate. Our forefathers, our mothers and our grandmothers know or knew when to plant their crops, depending on their region. They knew when the crops are going to be, how long they are going to take to get their crops ready. But today, because of this changing climatic patterns that actually is being caused by what we are calling the climate change, this has changed. And because of this change, there has become a lot of anxiety at community level. May it be farmers. In most African countries, farmers use the rain-fed agriculture. There is a lot of anxiety from farmers because farmers no longer know when they expect to plant or when the rainfall they're going to receive is going to be enough for a season. When is the, like in Kenya and East African region, we have the long rain season and the short rain season. These days, it's not very clear which is the long rain season and the short rain season. Now, because of that, this starts to have to weigh on our mental health. Now, if I just give a definition, a general definition of mental health, it is anything that affects your emotional, your psychological, your social well-being. And climate seems to be affecting all these, not only to the vulnerable community as we know them, because we talk about vulnerable communities mostly from a the social status, but to every member of a community that is living within the changing climatic patterns. Take, for example, I'm going to give an example of our climate in the East African region, and I take two events that have happened very recently that we all can, those who are living within the East African region, can relate to. Last year, around 2020, 2023, there was a drought in Kenya, in the East African region rather, and this drought was so rampant that farmers, pastoralists lost their animals, people are maltreated. There was general hunger in these countries. And this drought, its economic value was huge. Now, when we look at that drought, the one question we're asking ourselves, as we assess the economic value, how much psychological, emotional value can we attach to such a drought? When we say animals were lost, this man who had the animals and they could not save any of the animals, how much was he affected psychologically? How much was he affected emotionally? This woman in the dry areas who was cooking wild berries for her children, how much mental torture was that? So when we look at this, then we realize that as we are talking climate change, then we need to talk more about the psychological distress. Another example I give is in East African region still, late last year, that is the November, December season, and early this year, up to around April, there was another extreme. From the drought extreme, we came to the what we are calling the flooding extreme. That was so devastating, left so many people dead, so much infrastructure destroyed. And one thing that I personally is making me think about the psychology of climate change is that this flooding was not only on the vulnerable community, particularly those who live in the urban informal settlements, but it also affected people who are living in what we call posh areas. One of them was Ruda in Kenya, where people are so flooded that for days they could not leave their homes. For days they used boats to travel from within their compounds. And when you think about the mental torture for somebody who has a big home but can't go out because of flooding, then you can imagine that even today there is what we call the post-trauma, because this person doesn't know when this kind of thing is coming again. So these are two examples that I'm giving from our Kenya and mostly our East African region that is telling us that mental health is not only for the vulnerable groups, and research is not supposed only to be done to what we know, in quotes, as the vulnerable groups, but also on every other person who is affected by a certain climatic event. So now, what do we need to do? That now that we know that, how do we now bring mental health more openly, more forward now in the research for public health? Because mental health is something that is hidden. Mental health, most of the time we think mental health is just people who are maybe mad, but mental health is with every one of us. Because even now, if you are anxious, that it is going to rain so much that you will not be able to move with your car from point A to point B, that is also some mental issue that you are having. So it is all of us. And therefore, we say that we need a diversity of solutions following diversity of climatic communities. I am giving examples of the East African region. The East African region, particularly the equatorial region of the East African region, receives two rainfall seasons that we call the long rains and the short rains. There are other parts of Africa who receive one rainfall season. Many parts of Africa are dry, and they are also receiving very high temperatures. So we have diverse climatic conditions, even within countries like Kenya. The western region of Kenya do not have the same climatic conditions, and their extremes are not the same as those in the northern part of Kenya, western Kenya, east, the coastal region, and therefore we require diversity of solutions. So how do we get that? Diversity of solutions would come from diversity of research. And that diversity of research would mean transdisciplinary. We need to come together and think, the social scientists, the public health person, the climate scientists, the water scientists, all of us should come together in a transdisciplinary research and come out with the products that the GIS person can also help us now to map out what the mental prone areas, what is happening in the mental front of public health. We need to promote positive mental health to everybody. And I am saying everybody because all of us are touched. People have been drowned in their cars, and it is not only the people, the poor. This is not only something that is affecting the vulnerable, the social vulnerable communities, and therefore every social group requires some education on positive thinking, education on how to mitigate at personal level, at community level, whether you are living in the posh areas or you are living in informal settlements, how to do that, and how to do a community-based solutions to those problems, so that we reduce the psychological stress. I am sure now that there are people in those areas that were flooded, those people who used to move in a boat, they are still having that trauma. Every time it starts raining, they are traumatized. They don't know how much it's going to rain, how much they are going to be flooded, and such kind of things. Another method we can do is that we can think on a more community way how to abolish some of the debts that people are having. Farmers who are in cooperatives, they have gotten loans to grow their crops. The crops have failed. They have a lot of trauma. They actually are mentally sick because of that. If you remove their debt, then that can be it can help them. You can create cooperatives which are going to help the farmers when they work together. A cooperative is where people join together for a common thing, and therefore they can help each other in terms of, and there are so many other things we can do. But let me just mention that the transdisciplinary research is one thing that we cannot avoid in this area, because we need to amalgamate all the knowledge that we have from all the areas. And we need, first of all, to recognize that we have been trained in a monodisciplinary way, if I can call it that, what we are calling the silos. And when I think climate science, I don't think climate in a social way. I don't think climate in a health way. I don't think climate, but I know the science. I know the rainfall. I know how it can. This is now where we are calling the interdisciplinary, so that when we are thinking about mental health, we think about all the people we can bring together to have a common goal, so that when we bring out a policy brief or a policy document, it talks in all areas of knowledge. Personally, as I conclude and give my way forward, personally, I think not now for mental health alone, I think we need national and regional IPCC. From a talk I had yesterday, from what we were listening yesterday, we do not, I feel like we do not have a way as researchers, a connecting way to the policy. We do not somewhere where we talk climate change and all the adversities of climate change, and we have a common brief that can be read as a brief for a country, for a region, and then we can have, we can vote. As we talk internationally on IPCC, which is an intergovernmental, we need an like now in Kenya we have counties. Maybe we need an inter-county forum that can talk to the national government on areas of the effects of climate change. I stop there and we hope to continue as we continue. Thank you.
Thank you, Dr. Gashai, for pointing out the very important aspect that we need to be able to consider the mental health response in as we navigate the climate space. And of course, it brings out the aspect of the funding, because research, as I said earlier, informs practice, but funding is a big challenge. Basically, funding revolves around the very obvious matters. We also need to, as you pointed out, think of the complexity of the transdisciplinary and how to bring this all together so that then needs of the communities can be met, because the lens of the community is very significant. For there, the people, at the community level, that's where the impact is being felt. Unfortunately, it is a bit difficult to demonstrate the immediate impact of climate to mental health. And that also gives us a reason to be able to think differently, because oftentimes the scientists will look at the cause effect, but with the mental health, oftentimes, according to what I have researched and found out, many researchers speaking to mental health is on attributional perspective. So it is important that we delve deep as researchers to think, how can we be able to collaborate to showcase the need at the community, as well as leverage on what exists. To take us further, allow me to bring Luganda to speak to us on the opportunities that exist, especially in Africa, looking at research across the diverse regions. And of course, I know Luganda has been very instrumental in the Greater Horn of Africa in the climate space. So Luganda, you could speak to these issues. Welcome.
Thank you so much, Dr. Pamela, for this opportunity and the participants. We need to understand that we are facing complex challenges within our region, not only in the Greater Horn of Africa, but globally, having climate change, having health issues within the globe. So this comes that what is provided on the plate is very little, and we have competing problems which are taking up the resources. As I'm a fundraiser and also write a number of projects, but when it comes to transdisciplinarity proposals or grants which have been called, one challenge which is see that there are a number of silos whenever the silos in the funding mechanism. So some of the opportunities we can find to the researchers and also organizations which are working on transdisciplinarity is one thing is to see that there is a need of to develop a centralized one access fundraising system whereby at least one can know where to find these grants, because creating this creating this can make it easier. And since it's online, one can go to such a portal and register himself, even if a fund has not yet been advertised. If you register yourself, you see your eligibility. And one of also the challenges is eligibility, because you may find you have a good name, you are doing great work within the on ground, yet you can't have such a fund, or you can't apply for such a fund. So it is better if such a portal is available. It can help us to see that it can help to aggregate grants, fellowships, scholarships from international and also at the local level. So whenever these portals are being developed, it helps us, it helps the students, researchers, novice researchers, organizations, and practitioners to know at least where to find these grants, and also they prepare before the application is being advertised. Or some of the grants, even advertisement, don't wait, because of the good ideas and innovation being conducted by the students and also the researchers. So most of them, you just pitch your idea, then it is being taken up in case you have a good idea. Providing regional training and capacity programs. So this is one of the opportunity. I myself have been attending a number of summer schools and winter schools. An example I can give is the Qatar Summer School on Transdisciplinarity, which is now the second cohort. I participated in the first cohort, whereby I also, whenever I'm providing these opportunities to our participants, I'll mention also some of the challenges which are being faced into this. I saw it was a great summer school, which was on transdisciplinarity, bringing on novice researchers, early career practitioners, researchers within the field of climate risk and also climate change and mental health. But you find that most of the people who are within this were from the global north. Global north, I'm talking of the US, Europe, Asia, some parts of Asia, but few were from Africa, yet this school was in Africa. So as Africans, because when I was reading this, I read all the events, the side event, it's Africa-led, and also a lot of work within Africa. So we need to create a regional training platform or community or capacity building programs, which can help us to see that we find challenges, what challenges are we facing, what can we do within these challenges. So, and also tackle challenges at early age. For example, while students are still at university, to understand what is transdisciplinarity, whereby you need to work beyond the disciplines, bring in a number of practitioners, non-practitioners, and also all people within the field. But we need to understand also that we need to provide one thing which is called mentorship. Without a mentor, you never go far, and you never find such opportunities, because you may find people within the field, they are doctors, they are professors, they are practitioners who have been in the field for the last 25 years. And these are the people who are having these call for proposals. They are having contacts with World Health Organization, with WMO, and what I urge to our youth, novice researchers, mainly early career practitioners, is to get yourself a mentor. How can you get a mentor? There are a number, even within this conference. It has happened for the for the last 3 days. But if you don't, you can write to a person whom you have seen that is very good. You can write to a doctor whom you can see that they can help you out to see that you can develop yourself in writing proposals, in writing research papers, articles. You can co-author, or you can co-author in writing a project. So it's a matter of you yourself inviting yourself on the table. You write to these people so that you can make sure that you get a mentor. When you get a mentor, it will help you in support for the application processes, which could make funding opportunities more accessible. Funders and larger institutions could set up mentorship programs. For example, even ACCRC, which has invited us, and also the network which has created this, it can also have such programs whereby they bring people on board. And also, whenever we write projects, we can include a budget for this program to see that at least we have people who will come when we have left. So transdisciplinarity research often, we know that it tackles complex long-term issues with less immediate and tangible outcome. But without creating, if we use those opportunities I've created, at least we can see that we come up with a number of people who understand this field. Yeah, back to you,
Thank
Dr.
you.
Pamela.
Thank you, Devin, for bringing it out that way. And I am reminded of the GACOFs, the Greater Horn of Africa Climate Outlook Forums that we have been able, you and myself, to really push forward the agenda of mental health to an extent that in the recent outlook, you couldn't see some countries being able to issue advisories around mental health issues. I invite us to put in our questions on the chat that we can be able to respond to. Kindly engage that way. To make progress, allow me to bring Dr. Hannah to also make a contribution. Dr. Hannah.
Thank you so much, Dr. Pamela. And it's a very exciting forum. I've been here since the day it started, a lot of learning. And I also want to put in some information concerning how do we also bring in the aspect of funders consortia to ensure that there is integration of what we are discussing about. One of the most important things we have talked about, Lydia mentioned it, it is that climate change, there is conflict. We are seeing a lot of huge number of displaced people, migration, disease outbreak that are really affecting a huge number of people in the sub-Saharan Africa. And you find that there is a dimension that is growing in terms of traditional donors now and actors who are rethinking ways to address increasing needs in a space where funding also is decreasing. So the consortium funder framework is becoming more and more relevant in responding to saving lives activities and also addressing sustainable programs for better resilience of community. And this gives us room to see how well do we come on board with data that is useful to support the humanitarian and development intervention in terms of climate health. Another area to think of is about the cross-border coordination and intervention. You know, the escalation of this protracted and new conflict in various countries around us, the burdens of host communities and countries is increasing. And then it is important that the actors and even the funders, consortium, they come together to bring a comprehensive plan that goes beyond a short term, but looking at integrated, innovative nexus focus. A good example, look at what is happening with Sudan. In Chad, we have more than 500,000 refugees, who have fled there. But how do we bring a comprehensive plan where we take care of the welfare of their mental health and as well as their livelihood? So the donors are now looking at regional funding for regional actors on this emerging trend. Regional funding that opens ways for more research, data that is required so that at least we are able to feed into the needs of the community. Because any programming that needs to be done, we require the data. We require the researchers to come on board in a multidisciplinary way. So that we look at the aspect of the mental health, we look at the aspect of livelihood strengthening, protection issues that are really funded. How do we integrate all this so that at least the intervention is more holistic? There is also the issue of, you find a lot of mismatch of needs and resources. There is need to lobby for more funding instruments to match the collective outcomes, to address the flexibility of humanitarian and development plans for continuous learning. Look at, maybe let me go back to the ASAL areas here in East Africa. There is a need to build on opportunities on climate financing envelope, which is already there with the county governments and maybe other neighboring countries, where they are promoting One Health approach. How do we bring in research to bring the component of protection and to take care of people and women who are really suffering with mental health issues when men has already left them to go and look for livelihood, and yet they are working within an environment of conflict. And therefore, this calls for transdisciplinary strategy for research to build on evidence-based program for future application, and also advocating for increased funding in such context, and especially in Africa. I would also want to mention concerning consortia strategy, which has proved to be quite reliable and robust voice for advocacy in funding allocation, flexibility, and multidisciplinary focus. In Somalia, we have seen a consortium that has been developed by various actors coming together, looking at the issues in Somalia and voicing these issues in one voice. And this consortium has become so strong, and a voice even to influence donors to build more funding in terms of responding to anticipatory action, responding to community resilience issues, and livelihood, and all that. This is a space where more work is needed also to bring in the aspect of addressing psychosocial mental health issues, so that the community, they are able to have a blended or a holistic program. So there is some work that is going on, but we need to demonstrate through more advocacy to what is going on. Maybe I also want to mention building partnership through localization agenda. Remember in 2016, the Grand Bargain Summit, they talked about the roadmap for donors and actors to apply transformative pathways for communities through localized activities. And there has been a recent literature review done by Ministry of Foreign Affairs in Netherlands that showed collective localized approaches, they improve the quality of response provided. So there is need for more research that's new to be done on strengthening accountability in localized partnership within climate action and health lenses. And that way, when we have a localized intervention, we can also use localized ways to fundraise and to bring the voice of mental health issues at the community level, strengthening them with the lay as peace builders in terms with the knowledge about mental health, and they can become a voice also from bottom up.
Wow.
Lastly, I just want to mention about monitoring, evaluation, and learning, and accountability. The effects of disasters in Africa, they spill over to other neighboring countries. And this calls for a regional coordination for a joint monitoring plan involving multidisciplinary actors to document on what is working, identifying gaps, and areas for improvement. These results are very, very critical for donors in planning for future intervention and also donor allocation in Africa in the areas, what we are seeing around us. So I want to pause there. And
Wow.
if there is another opportunity, I can come on board for further questions and comments. Thank you.
Wow. Thank you, Dr. Hannah, for that wealth of information that you've given us. And I really see the importance of investing in research, and especially bringing in aspects of policy, so that then we can be able to monitor, evaluate, and also learn for future. Allow me to bring Dr. Designed to also put his voice in and especially bring the aspects of equity and ethics in climate response in relation to health. Dr. Designed.
Okay, thank you very much. And thank you to the previous speakers speaking passionately about the role of climate-related mental health issues. I also want to add on the role that research can actually play in this space. It's very important to, well, what we've recognized is that the component of mental health is still an emerging field that is sometimes not fully recognized, especially in research, policy, and advocacy work. And we find that in this space, there's need for more research to be done. The benefits of taking this approach is that it will help us to identify some specific ways in which climate change affects mental health, such as increased anxiety, depression, and also the post-traumatic stress disorders. Research is also going to help us to do a vulnerability analysis by analyzing which populations are most vulnerable to climate-related mental health issues, including marginalized communities and those with pre-existing conditions. I'll give an example of the work that the International Water Management Institute is carrying out. We did a forensic analysis of the 2023 flood event in the Somali region of Ethiopia. And we found out that the flood event in 2023 had some primary and secondary effects ranging from displacement, health risks, and so forth. But we also found out that these impacts go beyond only the physical risks, but there are also some mental related challenges that arise from such disasters. Such kind of research is also going to help in developing effective interventions and therapies tailored to address climate-related mental health concerns. It is also important for researchers to collaborate with communities to design culturally relevant and appropriate interventions that promote resilience and well-being. Going back to the study that I talked about, we are also collaborating with the communities and the local organizations there to design, to co-design anticipatory action approaches that integrates local practices as well as the scientific knowledge in terms of dissemination of early warning messages so that communities can get information in advance of a disaster and take appropriate action. Research also is important in terms of the provision of evidence to policymakers and also advocating for policies that integrate mental health into climate change adaptation and mitigation plans. So we have found out that it's important to bring policymakers on board, and part of our work also in East Africa is to co-design or co-develop policy briefs that increase awareness of climate change and also encourage integration of mental health challenges into policy issues. Research also is important in terms of raising public awareness about mental health impacts of climate change, and in the process also reducing stigma and encouraging action. And this can be done through quite a number of activities, including collaboration with the different humanitarian partners so that advocacy work can, even awareness programs can actually reach even the furthest of communities. Right, the last part is on the future directions. So what kind of research can we promote? Issues of longitudinal studies, which involves systematically tracking the long-term health impacts of climate change, will allow us to get a deeper understanding of the health issues. I think the previous speaker highlighted that in some places you find that communities have this anxiety that comes through repeated disasters. I'll give an example of Cyclone Idai in Zimbabwe, in Chimanimani. It happened in 2019, but you find that there are some residual impacts, psychosocial impacts, that when it starts raining, the communities sort of get into some kind of a psychological condition in which they feel very uncomfortable and they feel like they need to move to certain places. And this has some long-term psychological impacts. Also, there's need for coming up with innovative solutions that can actually involve latest digital technologies such as artificial intelligence. And lastly, there's need for interdisciplinary collaboration. This is the collaboration between mental health professionals, climate scientists, and social scientists, so that we can address the complex interplay of factors. And we are calling this the intersectionality of silos, trying to make sure that we break those silos and work together and collaborate and make sure that the issues of mental health are integrated into climate science. Thank you.
Wow. Thank you, Dr. Designed, for really strengthening our discussion. I note there is a question from Williams on what is the difference between mental health and psychological issues. Really, it is, they are used interchangeably, but as it were, when we look at mental health issues, psychological issues is basically how one is thinking, how one is feeling, and then how does it affect their behavior. And when we look at dysfunctional behavior, then we can be able to relate it to the thoughts of the person, and of course, triggered by what events, especially even with as we think about climate extremes in this time. And notable is that there is a gap in terms of data, there is a gap in terms of knowledge. I will say this because I have traversed Uganda, Kenya, Ethiopia, trying to work with the communities to pick out where do they place mental health issues. And you find that in the community, people do not understand. When you talk about a mental health issue, when you talk about psychological issues, some people have spiritualized it. It's like it shouldn't be talked about. The stigma that is related to mental health issues, still the knowledge gap. So we have a lot to do to be able to bring people to understand that there is no health without mental health, because there is an indirect relationship, of course, bidirectional. One can have a physical illness that will trigger a mental health issue. Then one can have a mental health issue that will likely lead to a physical illness. And there is a lot that we need to do as professionals in the communities to bring to the fore this knowledge, so that then people can be able to pick indicators, and therefore response is done, early diagnosis is done, and systems are put in place to respond to mental health issues. When we look at our continent, Africa, you find that even the professionals, psychologists, psychiatrists, the ratio of these experts to the population is quite high. So even diagnosis is likely not happening. I remember a study that was done in Kenya in 2019 that indicated that 40% of the people who are going for physical illnesses in our hospitals have an underlying mental health issue that is not diagnosed. And you find if it is not diagnosed, then it is not being treated. And that means people are being treated for physical illnesses when under it is a mental health issue, which then means help is not being offered, and basically because of lack of understanding. So we need to generate data. Research is very, very key. We need to get to the community and get to have an assessment of the psychological or mental health needs that exists, and then also map out the resource gap so that it can inform interventions. As we bring this, try to bring this to a close, I really emphasize the bit of the capacity strengthening in mental health institutions and also programs, as Henry is pointing out, because until we have the necessary resources, then we will continue to have gaps. But I believe ARIN, ACRCC, and other players on board, the med services, the professionals here, we will be able to pick from here and come up with approaches that will be responsive. Allow me to invite our speakers one by one to give us a one call to action, because I know our time is up. In one word, what is your call to action, Dr. Gashai?
Thank you. My call to action is interdisciplinary, transdisciplinary research. My call to action is coming together and forming policy briefs that can be used by our government, not just research for the sake of research. Thank you.
Thank you, Dr. Gasai. Can we have Dr. Hannah, your call to action?
Mine, I would say advocacy for funding so that we can do evidence-based programming.
Wow. Advocacy, evidence-based programming to respond to the challenges. David, your call to action?
We need a community of practice and also setting up different platforms which will help us in fundraising for transdisciplinarity in order to get these grants and also make sure that we coexist with other sectors or with other disciplines. So community of practice and a number of platforms. Thank you.
Wow. Wonderful. Thank you, David. And Dr. Designed? Dr. Designed, you're still in the house? Okay. Okay.
Oh, sorry. Sorry, I was muted.
Sure.
So my call for action is for the integration of mental health issues into the broader health policies, climate change policies and programs, and also the issue of capacity building. I think it's important to strengthen the capacity of professionals across the board, not only health professionals, disaster risk management professionals, climate scientists, for them to have the capacity to address mental health issues related to climate change. Thank you.
Great. What I hear is that knowledge is power. In Africa, we know that we have a wealth of experts, but then we need our experts to be retooled to actually be able to respond from a transdisciplinary approach, so that then we can be able to consolidate and bring to the fore the needs that exist from a scientific perspective, and also help our policymakers to channel resources to fund health and more so mental health issues. Because at the end of the day, if our population are not healthy, then our development will be skewed. Because when we look at the Sustainable Development Goals, climate action, we look at the Sustainable Development Goal on health and well-being, we look at the Sustainable Development Goal on inequality. We see the interrelationship between all these goals, and responding to one of them means we have to respond to the others, because all the 17 goals are so intertwined. And as an African continent, our sustainable development won't be spanned by a healthy population. So I call us as Africa to be able to think holistic, to be able to think mental health, to be able to think the well-being of our people. And of course, as it is driven by research, it's driven by data. I call also our network, ARIN, to really consolidate and bring together our professionals. Let's lobby with ACRCC and the others on board to have a national platform and probably influence a regional framework that speaks to mental health issues, integration in climate services, because we find that now we have a framework that looks at climate services. We also need to think a framework that brings on board a health response, and especially mental health in climate action, so that then we can be able to spur socioeconomic development, because the community lens is very, very critical. And from where I stand as ACRCC, I think currently, as I mentioned, a study that we have been doing, which is you find a bit of resources. I found out the importance of bringing voices of the people. We have had interviews with communities. We have had interviews with the women, how they are impacted, with the men, with the young people. When the voices of the people is amplified, then it means somebody somewhere will be listening, and we will be able to have programs that respond to the real issues on the ground. But as the climate scientists are telling us, the frequency, the intensity of climate extremes is increasing. I was reading yesterday, 2024 seems has been registered as the hottest year, and things are not looking up. We have, all of us, a responsibility to protect our planet. But even as we look at it, Africa is least in terms of contributing 4% to the causes of climate change, but we are highly impacted. So we cannot run away from the realities. We need to think and act smart, so that then we move our countries forward, so that we give solutions that will actually respond to the real issues. So I invite ARIN to move forward, to take over. And I believe that as ACRCC, I need to invite us to a conference that will take place on the 9th of December, where ACRCC is going to release the findings for the 3 countries on the nexus between climate change, food insecurity, and mental health. It was a pilot study that was funded by Canadian government. We are currently doing the data analysis and report writing, so that on the 9th of December, we hope to be able to mount a hybrid platform that we can release these findings, engage with the findings, and then ask ourselves as Africa, how can we upscale this? How can we then be able to have responses that will help our continent? I want to take this opportunity to thank the team that has really made this possible. Dr. Anna, Dr. Lindia, Dr. Designed, and Luganda, thank you for making Africa proud. Thank you for your contribution, and may the Lord bless you. ARIN, over to you.
Yes, thank you, Dr. Pamela, and the whole ACCRCC team for holding this side event. It was quite impressive and insightful on how we can leverage the transdisciplinary strategies to integrate mental health into climate resilience planning. So without further ado, because time is not on our side, I just want to encourage you to stay on the line as we go for a 30 minutes, well, right now a 27 minutes break, as we anticipate our main and final session of our conference, which is themed strengthening funding opportunities for transdisciplinary research and climate research and action in climate and health research. we will have diverse speakers from different regions, and especially the funders who are going to address on how to make these funding opportunities more accessible to researchers and organizations across the African continent. And also we'll have an explicit overview of what challenges that these researchers face in securing funding for transdisciplinary climate and health research projects. So I just welcome you to stay on the line, and looking forward to your valuable contributions as we start our main session at 2 p.m. Thank you very much.
Thank you, we appreciate.
Maybelline New York New Lifter Plump. Warning, intense heat, lasting plump. Maybelline New York New Lifter Plump. Warning, intense heat, lasting plump. Maybelline New York New Lifter Plump. Warning, intense heat, lasting plump.
All right. Good morning, good afternoon, good evening, everyone, our esteemed participants. Welcome to the very last session of the ARIN 4th International Conference on Climate Change and Health. My name is Lavenda Ochieng. I'm a research assistant at the Africa Research and Impact Network. I will be your moderator for this session. So first of all, I really want to welcome you all and thank you so much for being here and really making it to the very last session of the 4th conference on climate change and health. So as you all know, our theme is bridging the knowledge gap, looking at the promoting transdisciplinarity for climate and health resilience in Africa. And the past 2 days have really been insightful, looking at the various topics that are really amazing. The first one, promoting transdisciplinarity, looking at the status of climate change and health in Africa, and not forgetting the opportunities for enhancing transdisciplinary climate and health. That was the topic for the second day. Various insight has been put there. Various organizations are really doing an amazing job out there. And key call for actions that are really being made is the aspect of collaboration, the aspect of having communities in our researches and leveraging on indigenous knowledge. We need to strengthen the science, the policy interface. Also, we need to realign our research with the national plan. A lot has really been said. And in this very last session is whatever we really need to do. Research is really great. We're really doing an amazing job, but the aspect of finance really needs to come out clear. We really need to strengthen our funding opportunities in order to ensure that whatever we are doing is translated to something impactful, something that really impact people innovatively out there. So this session, the last session of the ARIN International Conference, we're going to tackle how to strengthen funding opportunities for transdisciplinary climate and health research and its impact in Africa. So we all know that funding is a lifeline of change. When we strengthen it, we are very sure that we are addressing the Africa's vulnerability to climate-induced health challenges. And also, while investing in these things, we really need to know that the approaches that we use when we integrate climate science, when we integrate public health, the local community knowledge, we are very certain that the funding that we will acquire will empower Africans, nations to develop innovative, context-specific strategies that will really build resilience. So the purpose of this session is just really to explore the critical role and the pathways for securing funding for transdisciplinary climate and health research, and also address the complex environmental public health challenges that require substantial resources and support. So without further ado, I'll just go through our program. We will have an opening remark for our esteemed director, Dr. Atela. Thereafter, we'll move to the keynote question that will take 25 minutes from Dr. Bade. After that, we will have a key discussion from Dr. Victoria, which will also take 25 minutes. And then we will have the case study presentation from various presenters who are really doing an amazing job out there. And we'll have a final discussion after that, which will take close to 40 minutes. And then lastly, we will have a Q&A and the synthesis of key insight, and officially close the ARIN 4th International Conference. So without talking too much, I'll welcome our director, Dr. Atela, to give us an opening remark and probably speak briefly on the status of evidence in Africa. Dr. Atela, over to you.
Thank you very much, Lavenda, for the wonderful opening remarks. Thank
Dr.
you very
Atela,
much.
if you
Yes.
can hear me, if you're speaking, you're on mute.
No, I'm on mute already. Unmuted. Can you hear me?
Yes, yes.
We can hear
Proceed,
you.
you are okay.
Okay.
Yes.
All right, yeah. Yeah, so I just say thank you, Lavenda, for the wonderful opening remarks. And thank you to our participants for being consistent and engaging with us in this conference and discussing the fundamental issue around transdisciplinarity on climate change and health. As Lavenda said, we've had a very exciting 2 days already, very engaging, with main sessions that initially started by looking at the status of research or status of
of evidence with regards to climate change and health in Africa, and with a number of accompanying side events, which again were really exciting. And of course, there were quite a number of insights that emerged from that first day. And I think somebody will come in to just remind us of some of those key insights. And the second day, we had yesterday, we had very key engagements and discussions centered on opportunities for enabling transdisciplinary research and action for climate and health in Africa. And this means that now, having known the status, then we look at the opportunities. And again, there were fundamental insights that were raised from issues around collaborations, issues around opportunities to nurture really transdisciplinarity and provide spaces where transdisciplinarity can be nurtured in a sustainable way. And in that also context, we did launch our platform called the Consultative Platform for Climate Change and Health in Africa, CAPTCHA in short. And that platform is one of its kind in the sense that it tries to make the discussion or the conversation around transdisciplinarity not a one-off workshop event or a one-off project event, but a continuous process, because climate and health are actually bringing together multiple sectors, of course, led by the climate community, but also the health community, both of whom have been doing wonderful jobs in terms of research, in terms of policy, in terms of advocacy. But we all know that the linkage and the integration between these two communities have been very, very weak, as they continue to work in silos. And with that working in silos, we end up with fragmented evidence, fragmented solutions, which are not able to really confront the complexity that is brought about by the challenge. Now, today we want to look at the funding issue, which is really very critical topic and a critical issue as well, because there's nothing you can do without funding. You can have all manner of innovative ideas, excellent plans and agendas, transdisciplinarity, collaborations, partnerships, equity. You can talk about all of them. Without resources to move the process forward, it becomes very difficult to really ensure that some of these ideas are actually implemented. Just to quickly reflect a bit on some of the work we've done with regards to the landscape of funding in Africa. And I hope we should be able to share this report with the participants. So it's a work that we've done, a study we've done, supported by Welcome, and was looking at really what, the opportunities for building a sustainable and effective community of practices that could enable transdisciplinarity. And what we found is that in the context of funding, that the current levels of findings for climate and health actually remain inadequate. There's really very low levels of funding. But there is an increasing passion or an increasing interest of funders to continue supporting the field. I mean, there's just a lot of mobilization, a lot of funding opportunities that are emerging in the area of climate change and health, from Welcome to IDRC to National Research Council. There are a number of them, and even funders are trying to come together to form coalition so that they can increase the pot of funding. The big question is, what are they going to fund? And those are the questions that we need to answer as a community. We also found that there's overlapping funding from international donors, which again creates some aspect of fragmentation and inefficiencies. But again, we see efforts to really bring funders together in order to foster a coordinated approach. We've seen a number of initiatives that are building coalition of funders around climate change and health, and with targets that really could revolutionize the funding situation for CNH in Africa or in the world. And again, what we noted also is that the domestic funding for climate and health, especially in Africa, remains very low. And in most cases, these funding portfolios are not fully developed. Actually, in most African countries, there's still very limited institutionalized or developed funding that focuses on climate change and health. While there are fundings that are looking at climate change, on one hand, there are also funds that are looking at health on the other hand. There's really very limited systems, domestic systems to support climate and health. Again, we found that funding from the global north is frequently channeled through institutions in those particular regions. And this often disadvantages African researchers. So this is a major question. I mean, it's a bigger question around the mode of delivery for funding, where a lot of the funds that are available often target developed country researchers. They're channeled through developed country researchers. And you find that almost 80% of the funds that are availed to support research in Africa remain with the developed country researchers. So you end up with a lot of publications, a lot of ideas, innovations, which are good, but they are from outside and are not or cannot be properly institutionalized, understood, or implemented by the African institutions and the African researchers. So there's need to really strengthen the Africa's through dedicated affirmative action so that we have Africa's leadership with regards to the targeting of the funding. And finally, we found that also while the focus for funding for transdisciplinary research and policy development is gaining traction, international climate finance neglects the critical practical health activities on the ground. So there's a big issue while we see funding for research and policy increasing, we actually don't see a lot of funding to support the development of health resilience projects that could be supported or could be funded by some of these international funding portfolios, such as the the GCF Adaptation Fund, among others. So there are big and many questions that we need to unpack, entangle, and really rein through in this particular session so that we are able to understand these particular opportunities. With those very few remarks, Lavender, on behalf of the Africa Research and Impact Network, I want to once again welcome our participants and just to inform them that as ARIN, we are passionate about fostering collaboration, fostering transdisciplinarity. Being a network of 200 researchers across 36 African countries, we are very strong in the area of evidence consolidation from the different African contexts and creating the continental leadership and South-South collaboration that is much needed. We also provide a very strong peer learning and convening platform where some of the innovative approaches, research, and impact practices can be shared and also be made visible to the world for policy and action. So thank you so much, Lavender, and I give it back to you.
Thank you so much, Dr. Atela, for that insightful opening remark. That is really grateful. We know that whatever you realize is the funding in Africa, the funding, especially in climate change and health, is really misaligned and is not really targeting the needed sector, is not need-based. Again, or the funding from the north is really channeled through institutions and doesn't really need or doesn't reach the researchers, and work that we are doing is just kept within the boards or anywhere you're keeping those books. They are not really translated to evidence or impactful actions out there. So we need to do something better. And the next question from the keynote speaker, we will ask her, or is him, sorry, let me just get that. What challenges do researchers face in securing this funding for transdisciplinary climate change and health in Africa? So our speaker will be Dr. Bain Lushuo, who is a global public health physician, implementation research scientist and empirical bioethicist with over 15 years of global health experience. He has a diverse background and experience working in sexual reproductive health and rights, global health research funding, climate change and health, One Health, research empirical bioethic, health system strengthening, and evidence synthesis. Dr. Lishaw, welcome. You have 25 minutes. Kindly let us know what challenges do researchers face in securing funding for transdisciplinary climate change and health research in Africa. As Dr. Taylor has said, these are the challenges we are facing. Kindly go ahead.
Thanks so much, Lavender. I don't know, is it possible for me to share my slides?
Please, feel free to do so.
I just want to be sure that it's on presentation mode.
It's not.
Is that okay?
Kindly just, okay, it's there. Yes.
Okay. No, thanks again for the invitation, and I'm sorry I'll have to modify the title a little because we have been talking a lot on when it comes to challenges. But I think towards the end of my talk, I'm also going to talk about some opportunities because I think there is quite some opportunity within the space. And throughout the talk also, I will actually try to focus on transdisciplinarity. It just happens that my PhD was actually around transdisciplinary solutions in global health, so it's just a coincidence. I think it's really important for us to rethink transdisciplinary research. And I think Scholz and Steiner, they give a very good definition by saying transdisciplinary research integrates knowledge across academic disciplines with non-academic stakeholders to address societal changes. And I think this is really very, very important and very fitting to climate change, because when you look at the impacts of climate change on health, I think this is one of the most challenging issues that we are facing as a global community as we speak. Although transdisciplinary research is a promising solution, it's really important because most people really don't actually understand what it means. And there are still a lot of theoretical, empirical, and practical challenges to when it comes to understanding this notion. It's true, you need to bring people from academic disciplines, non-academic disciplines together, but it's not because you put people with very high levels of expertise in their various areas of interest that things are going to work. So it's important for us to rethink what are the best practices in transdisciplinary research? What are the best practices is actually making things work, getting results when you actually bring these people with these diverse levels of expertise into the same room, which is really kind of imperative when we are thinking about climate change and, most importantly, the impact of climate change on health. It's clear that transdisciplinary research, most importantly for climate change and health, is really important. We are thinking around the holistic understanding and complexity when it comes to climate change, the need for innovation, and innovation would certainly require combination of various disciplines and various lines of thoughts. Policy relevance, so that this should actually align with the bigger or the larger societal need. Improve adaptation and resilience, because this is really important. It's not only today that people are actually facing the impacts already on climate change and health. The people have already been facing the impacts of climate change on health. They have already come up with mechanisms of adaptation. So it's important for us to actually understand, maybe from a lived experience point of view, how these people have actually been getting these adaptations, because there are some kind of best practices that we can also learn from these people or from these communities that have already been impacted by climate change and health. And lastly, but not the least, the equity and inclusion dimension, which is better enhanced or conceptualized, where you bring people from various disciplines. Jumping into funding, maybe we just a reminder on some basic philosophies of behind the funding models. We have the collaborative science funding models. We have funding decisions which are normally supposed to be based on quality and excellence. We have grand challenges models where you bring in all this blue sky innovation. And you also have the IASA platform for instance, and the SFA model, which actually balances not only excellence, but actually brings in the notion of equity. This should actually be comforting at times, because it's not because your grant application is rejected that is not a good one. At times, it's actually when these equity dimensions are taken into consideration. But maybe a reminder from Jacob and Chrysler when it comes to the notion of grantsmanship, which I think is really important. And he says the art of grantsmanship would not turn mediocre science into a fundable grant project, but poor grantsmanship will and often does turn very good science into unfundable grant proposals. Good writing will not save bad ideas, but bad writing can actually kill good ones. I think this is food for thought for us, or for researchers, as we set into this ocean of looking for grants or putting in grant proposals. Most importantly, within the space of climate, and also the space of climate change and health, where there is a relative discrepancy between the need of funding research within the particular space and the available funding that we actually have. And I think it's really critical when you think of, when we are thinking of how to put successful grants, to reflect on generally what we call the SOAP principles. It's important, where the S actually stands for selection. It's important to select the correct funder, to own the process, because to understand exactly what the funder wants and actually invest time and resources to actually give the funder what the funder wants. At times, there are moments we are really overambitious. We have a lot of things that we want to put in. I'm not speaking as somebody who was working for a funding agency. It's really important just to follow the template that is actually given, because the job of the program officer or the grants officer is not only to review grant proposals. He has a lot of work to do within his portfolio. So at times, it's really important just to follow the instructions as prescribed. And it's also important to understand the grant managers. If you have the opportunity to meet with them, meet up with them, chat with them to understand their needs and motives. It's important to know that grant managers are not machines. They are also human beings. So they are human beings behind the grant managers, and this is really important. How to succeed, I think, in my opinion, and most importantly, when you look at the climate change and health space, you need to rethink and be sure that you have a good idea, it's a good match, and you have a good plan. Integrate, most importantly, elements of novelty and creativity. Think through whether there is any significance that you're actually bringing or adding into knowledge in a particular field. That's why I think it's really important to do your homework, get to the literature to actually identify the gaps that are in the field, and see how the findings from your research can actually be impactful or translated practically. I'm actually thinking around the important potential applications of the findings. And we are thinking of research novelty. I think the Reme University actually has a very good quote and actually explains the notion of novelty really nicely, where they actually say originality may seem shown in several ways, but you think around issues as, is this an important problem? Is there an existing problem in the novel and useful way? If it's something that has been done in the past, have they previously ignored like the material that you think it's really important? Do you think what you're actually putting together, or you want to investigate, is going to bring any new significant insight? And whether you are incorporating what you are putting is incorporating into the proposal is acceptable, or you have any important new elements in the design or in the execution of the investigation. So the notion of novelty is not, it's an important notion, but that actually requires deep thought before actually putting together a proposal. I think I've already mentioned when it comes to, in terms of your criteria, to really be sure that you are actually a good match. If I go back to put on my former funder hat, I think it's important for us to reflect on what funding agencies generally look for. They look for the relevance to the objectives, they look for whether your team is well constituted, whether it's competent, whether the science is sound. The institutional integrity, this is really highlighted because it's really important, and maybe I'm going to come back to this. There are moments they might be very interested in issues when it comes to gender balance, gender equity and inclusion, whether you're using gender transformative methods, intersectionality to be sure that you are not creating new pockets of inequalities and equity. I might insist on these particular aspects at times because they are really important, and at times, even when they are not explicitly requested by the funder, it's important for you, if possible, to actually include these dimensions when actually putting together the proposal. Other issues are whether they align with any development needs, for instance, SDGs, whether you have a robust monitoring and evaluation plan, a dissemination plan, and policy relevance. Because at times you shouldn't only think of dissemination and policy relevance at the end of your research. It's important to co-create these communications and dissemination plans at the conception phase of your research proposal, and whether you actually comply to the requirements that are actually set out by the funder. And I'll end with strategic alignment. It's really important to take off time to actually look at what if it's possible to take off time to look at the strategic plan, the vision, mission of the funder before you actually put together a research proposal. Let me come back to institutional integrity. The art or the notion when it comes to winning research funding, all of us know that it's a gradual process, and it's usually start with very small research grants. And if you don't perform well with very small research grants, you certainly get into the bad books. And it's important, as you are going to see as this talk actually unfolds, to know that when you get to the bad books, at times the funder might not come back to you. And you should also note that funders talk amongst one another. So if you get into the bad books of one funder, it's possible that you are getting into the bad books of many funders at the same time. So just a few ideas around why some funding proposals might fail. It's common knowledge that the number of proposals and requested dollars will always exceed the number of the available resources that we have. But the general rule of thumb is that 80% of proposals submitted will fail, because that's just the way things are. But generally, bad proposals will fail, but many excellent proposals also fail to make the funding line. So at times, it's not because your proposal actually fails that your proposal is a bad proposal. There are lots of things that really do not fall within your power. As I mentioned earlier, the first, the amount of funding that is available. Secondly, there are issues when it comes to equity. So your proposal can be excellent, but due to equity considerations, might not go through. At times, it's also important to know whether there is, with the level of evidence, whether the proposals have a good track record in doing good research or publishing research. There are issues around cost effectiveness of your particular project. If your project has like really excessive overheads, a good chunk of the proposal that is going to salaries, there's a high possibility that the very good proposal is going to be put aside. That's why it's really good to go through the books or the requirements of your funder. There are issues around feasibility, whether you have a strong research team or a new research team, and there are issues when it comes to balancing different research areas. And I think this is where we have the strength of transdisciplinarity, most importantly, when it comes to complex subjects like climate change and health. A few tips for success. It's important to understand the funder expectations, as I mentioned, crafting compelling proposals, building partnerships, and working in consortia. Most funders are increasingly getting interested into proposals that have intentional and clearly defined how partnerships are going to be built and sustained, and most importantly, proposals that are intentional in building a consortia. Networking is really important when it comes to the line of winning proposals. It's really important, and as you're going to see towards the end of my slides, to actually come up as an organization, as times, if it's possible, to actually come up and be intentional and fun in networking strategy. And you have to be persistent. It's not because you were not successful the first time that you're not going to be successful the second or the third time. Now, focusing on the couple of challenges in obtaining funding. most importantly within the climate change and health space, it's clear that there are limited funding opportunities, but we have to be proactive, we have to be persuasive, we have to be persistent, and if you have the opportunity to have a long-term engagement with the funder, and as you're going to see, it's not nice to be shy. It's not even warranted in the world of today to be shy. You need to be proactive, and you need to disturb the funder. You need to disturb that grant officer all the time. That's really important. There are also issues when it comes to institutional and infrastructure gaps. At times you can have a very good proposals, but if you don't have a very robust structure, if you don't have a robust track record in managing big grants, at times you can have a good proposal, a good team, but the funder will not be interested in giving the grants to you. That's why it's also important to build this, invest in putting very robust systems in place. I can think of the good financial grant practices, which is actually something now that most funders are actually looking after. So investing in processes to have these systems in place is of utmost importance. Yeah, there is low local investment. When we are coming, if you think of the African context, the amount of research that is actually funded. If you think of research, think of the Algiers Declaration of 2008, where countries are expected to invest at least 2% of the national budgets to health research. Even if the Abuja Declaration of 2001 is not respected, you can then just imagine what is happening with the Algiers Declaration. So when it comes to funding, most importantly with the health space, it's almost negligible. But we have to see how we can go around this, and there are really a lot of things that we need to do. And I think in terms of opportunity, to actually rethink the opportunities that we have around when it comes to local philanthropy and the private sector. And there is an interesting report that was actually sent out in August 2024 with very nice recommendations, which actually dissects the philanthropy ecosystem in Africa, which was funded by the Oak Foundation. I would really recommend us to look at this report. There is a lot of opportunity when it comes to falling back on local African philanthropy to fund climate change and health research. There is perceived lack of expertise. It's really clear, and as I mentioned, from a conceptual level, from a theoretical level, from the epistemological level, it is important everybody knows that we need transdisciplinary research, but how? People don't understand this. It's important for us to actually dissect what we actually mean by transdisciplinarity in climate change and health research, and actually train people when it comes to the best practices, putting people with different expertise, academic and non-academic, in the same room with the same activity, with the same objectives, to actually see how to make things work. Within our space, there are some funders that are really very interested in funding research that shows impact. But when you look at complex subjects like climate change and health, a very clear and important question now that actually stands out is, what is impact? What is impactful? What is impactful research when it comes in the climate change and health space? And I think impact within this particular space is a notion that has not been sufficiently unpacked, and it's really important for us to unpack this particular notion to be capable of conceptualizing this particular notion properly, operationalizing the notion properly as we put proposals to actually convince funders to actually fund research within the climate change and health space. And as I mentioned, I think there is quite some opportunity. Most organizations now are getting themselves within what we call decolonized funding models, where most of the funding now is going to come to respected institutions, I think ARIN, to actually decide on what is important, what are the problems, do the prioritization process to come up with the actual climate change and health issues in the continent. And I think this is an opportunity for us as researchers within the climate change and health space to capitalize on. Building South-South partnerships actually sends a very good signal to most funders, and that is really important. Actually investing in robust grant management system, as I mentioned, good financial grant practices, I think it's really going to be an opportunity to actually showcase to funders that we have the systems in place to manage very large grants. This so that they shouldn't have an excuse to pocket or to send directly these large sums of money to the continent. I think one of the areas we have not been doing well has been around as a global community in science communication to actually communicate properly, but most importantly, to invest in the politics and diplomacy of funding. It's clear the funding space has a lot of politics, it has a lot of diplomacy, and we really need a lot of training in funding politics and funding diplomacy to actually occupy the space that we actually deserve. And as Ambassador John Kengasson in the US actually puts it, if you want expected change, you actually need good science and good politics. We need to be intentionality, investing in strategic networking, as I mentioned, as organizations. As I said, it's really important to invest in pay sponsor staff to attend important events that matter, conferences that matter, and be on the social media. For instance, have proper websites, because people are not actually going to come to your room or to your office to see what you are doing or see your aptitude. So the website is important, your social media presence is important, making noise about yourself is important. That's why I said you have to stop being shy. I think I've already mentioned about the market, the essence of doing more proactive and effective marketing and communication. And I'm going to repeat the notion of integrity. It's important. If you have a $2,000 grant, a $5,000 grant, is important to get into the good books, because there is actually what we call funder inertia. As I said, the funding agencies, they have limited staff who have a lot of work. And if you're in the good books, they don't have a lot of energy to go and look for another person. But if you are in the bad book, everybody wants risk aversion. The person will run away from you. And as I mentioned, funders speak to one another. It's important to take our time to write out good proposals. Generally, proposals in a hurry might win, but when you actually plan over time to take time to write good proposals and have like very constructive feedback from non-specialists or people that are not actually found within your particular field, most of these proposals have a greater tendency of actually winning. And within the climate change and health space, as I said, and which is happily the subject of this discussion, transdisciplinary proposals, most importantly within this space, are actually the winning ones. But the major question is properly conceptualizing the notion of transdisciplinarity, operationalizing the notion of transdisciplinarity, and integrating best practices when it comes to undertaking transdisciplinary research within your research team. I think with this, I'm going to end, and if there are any questions, I'm happy to answer. Thanks for your kind attention.
Thank you, Dr. Bain, for that insightful presentation. I think whatever came out clear is the aspect of having good proposals, the aspect of having integrity so that you don't end up in the bad book or the black book, as others put it. And also, another challenge is the limited funding, the low local investment, and also whatever I notice is all researchers should do proposals in line with whatever the funder needs. All right, thank you so much. We will have a session for question and answers. Let's just hold on. In case you have it, you can just put in the comment section. I'll read it for you at that time, or we will have a session. You feel free to raise your hand or react as well. So one challenge that you mentioned was limited funding opportunity and low local investment. And our next speaker, who is Dr. Victoria McGovern, we will ask you a question. How can these funding opportunities be made more accessible to researchers and organizations across the diverse region of the country? So Dr. Victoria will come in for 20 minutes as well. She runs the Barrows Wellcome Fund programs in infectious diseases, climate change, health, human health, and workforce development focused career guidance for trainee program. Since her postdoc, she has been involved in science policy efforts related to strengthening the scientific workforce. So Dr. Victoria, the floor is yours. Kindly let us know, how can we have these fundings more accessible to researchers and organizations across diverse region of the continent Africa? Go ahead.
Okay, that's a very big question, and I hope I can give you some thoughts that are helpful to you today. And I hope I can manage to put slides on the screen well. Can you see these okay?
Yeah, we can see it. Go ahead.
Okay. And I think that today I would like to talk to you about the topic you've asked me for, but I'm also going to keep an eye on the clock because I think the discussions that follow are very important. I'd like to leave you some time for more questions for your keynote and to get on with your important business of the day. So I'm Victoria McGovern. I'm the Chief Strategy Officer at the Boroughs Welcome Fund. We're a funder that focuses on giving money in the United States and Canada, but our grants are spent around the world. So this is a little bit of a hard story for talking with African scientists about, because it means that, like some of the cases that were discussed earlier, this is funding that you'll have to have a northern partner to, and where the accountancy will happen in the north. That's just the way that we're set up, and many other foundations are set up that way too, with a limited funding geography. In today's talk, I want to tell you some about how we, a fairly modest-sized philanthropy, are thinking about climate and health research, both for the sake of knowledge and to promote actions that will make a difference in the world. And our thinking in this area fits very well with the thoughts.
Sorry to interrupt. Kindly adjust your camera. We can see you well.
Okay, I'm sorry. I can't see me. Is that better?
Yeah, I can see you now.
Were you only seeing half of my face? I'm very short. No, I'm not very short. The camera is funny. But is it good now?
It's okay.
Okay. Thank you. I should have a sock puppet to talk with you too. So, as I was saying, when I was thinking about what I wanted to talk with you today about, I was reading the report from July, and I think it is so in line with what I'm going to say that much of what I'll say will be familiar. And what I want to tell you about today is how we have been thinking as we've developed our newest grant program, which is an institutional program meant to help universities become centers of excellence that will really set the pace for what great research in climate and health will look like. And in thinking about how to do that, we thought a lot about the problem of interdisciplinarity. Universities are a place where there's great collections of knowledge here in the United States. And so it's natural that we think about giving money to them when we want to coordinate large efforts. In different African countries, there are other places where great expertise is sitting, including in ARIN. And so when I'm talking about universities, please don't take that to exclude people who are working in non-governmental organizations and working in consortia and other kinds of organizations. So thinking about interdisciplinarity, we see it as a wheel that keeps turning, that you come up with new ideas about how to have solutions happen, and you work around them to understand the problem so that you can truly take it on, and then you'd have innovation. You come up with solutions, you take them out to the people who need them, and you'll find out, whoops, the innovation was brilliant, except for the part it doesn't work in the real world. You find out how the real world works, and you go back to the research and ask yourself again, what can we do to move things forward? We really see a problem in getting people who think in different ways together. You know, chemists like to talk to chemists, engineers like to talk to engineers, policymakers like to talk to policymakers. And so we wanted to design a grant program that was really pushing people to talk across disciplinary lines. And in an unusual move for an organization that's very much focused on scientific basic research, we want to include people who never even come close to health research in some cases, like people working in the humanities. Historians have great insights into how people in the past have solved problems. You know, anthropologists, sociologists, archaeologists all have big insights into past situations, including flooding. They can be very important for climate change. And we need to remember they're out there and create on-ramps for them to come into the research world that people who are in fields like biochemistry so easily occupy. So in thinking about a program to develop, we came up with this one that's now being offered. It's our CHECS program, Climate and Health Excellence Centers, and it's an institutional award to accelerate interdisciplinary research at the interface of climate change and human health. As I said, we are only going to make these grants directly to institutions in the United States and Canada, but this work can be done in the rest of the world. And so if you have partners at universities in the US and Canada, this is a good time to be talking with them to see if they're planning on putting in one of these, and if you may find a way for your work to be involved. We want to see new engagement of the health sciences with other sciences, especially things like engineering, agriculture, the people who put civil engineers who put buildings together, everything that impacts how we live, because this is a very big problem, climate change, and the ways that it impacts our health are going to be large and complicated. We want to see our grants, which were going to be $10 million. We want to see these grants not just funding some research for a period, but actually increasing the institutional capacity for innovation. And that means this is a fairly unusual grant in that what our goal is along with the research we want to see happening, we want to see these places become more able to continue doing the kind of research that we're supporting. We would think it was a great success if 10 years after our grant ran out of money, people were still talking across institutional boundaries and still finding ways to work with one another to have real impact in the real world. So why universities? Again, universities tend to be the place where there's an awful lot of knowledge concentrated here. But we really like thinking about what can be done in classrooms. By thinking about classrooms in a big way, not just universities or graduate school or medical school, but everything down to small children. We think that you have great ways to integrate what you're doing at the research end into regular people's regular lives. So you can teach college students what you want them to learn, and it may influence what they go on to do with their lives. But if you teach elementary school children or the smallest children about their health and the environment, it'll go home to their parents and may change how their parents think, may change how the whole community thinks. We think that connecting students across universities and across university programs is also powerful, because these youngest researchers, youngest learners, like to talk to each other. They're not so much like professional researchers who have their own territory, which they may be connecting. And so students are very good at spreading ideas. We think that classrooms are also a great place to explore potential new policy ideas. Some ideas become verboten in the big world very quickly because it's clear that one idea has no support or another has no support. But in a classroom, children are very free to explore. And so getting high school students to argue over how they think the world should be can really produce some great insights into possibilities that adults may not think about. Finally, academic calendars are terrific. Academics have to get everything done within the 9 months or the 12 months or the 18 months. They're very used to thinking about what's achievable in a 3-month semester or a 6-month half year. And I think that that's useful for problems as big as climate change, because when a problem is so vast, sometimes it's hard to just get started and do so. In our grant program, what we want to see is people training professional students. And what we mean is things like graduate students with PhDs, medical doctors, nurses, public health practitioners, and to see them being trained together, not necessarily carrying the whole curriculum forward with them. That would be absurd. We want to have engineers who are engineers and PhDs who are experts in their fields. But we want them to be spending enough time with each other when they're in that malleable student mode of their lives, so that they finish not only being an expert in the thing they intended to study, but also with a good feeling for what other kinds of experts do. We think this is how to get interdisciplinarity carrying forward into the future. So beyond academia, there's the problem of what do you do with the community? And I think climate change is an area that is really sharpening everybody's thinking about the importance of informing the communities around us and bringing them along in our discovery, including when our discovery is we thought we knew something and we just don't know anything. We have to be honest with our communities. about the problems that are in front of us, the scale and scope of them, and how we're doing on finding answers. And we have to admit that when we don't know what the answers are and are just exploring and trying many ideas. Partnering with community groups to gather data or to amplify voices not typically heard is one way to do that. Faith-based organizations often have substantial networks and can go a great way to connecting researchers with the ideas that are out there, but not necessarily close to them. Partnering with those serving similar places, similar people, or similar environments. That's a strange thing to say. So let me explain it a little bit more. In the United States, what we would mean by this is, for example, New Orleans is a place that has had terrible climate catastrophes. But New Orleans has things in common with many other cities on the planet. It's a city where the river is important to their economy, livelihood, and to their climate problem. It's a city on the coast, on the Gulf Coast of the Gulf of Mexico, an important coastline of the United States. And so it has problems in common with all of those other cities. It's up next to a large lake, so it has problems in common with the universities around the Great Lakes here in the United States, but also around Lake Victoria, where you are. So thinking more broadly about the problems that are very local to somebody can illuminate potential partnerships that might not be obvious when you're just thinking, who do I know? Who can I call tomorrow? And finally, learning from those who disagree with your priorities. I think as human beings, sometimes we don't like to go out to talk to people who don't think much of what we're saying. But finding a way for research and public health to go out and listen to people who are not at all convinced that what we're doing is the right thing is probably a great way to find new things to think about and new approaches to the problems we take on. In our program, we think enhancing collaboration is so fundamental that we want to make sure institutions are paying close attention to it. We want to see them not only striking up collaborations now with the little grant, but doing it in a way that we believe when they explain it to us in the grant proposal, that we actually believe, yes, these people will still be talking to each other 10 years from now. Yes, these people will be knowing each other at holidays and seeing each other at football games. They're not just going to have a relationship that ends when the dollars run out. And we want to see people who focus on understanding problems, basic researchers, and people who are on the practical side of things, like engineers and like public health practitioners, spending more time together and informing their practice between them. The program also requires community focus, and that's going to be something that I think is going to really stump a lot of potential applicants. What we want from these grants is not only to see the recipients doing the typical things you do with a grant, but also investing new energy into talking to the communities around them. And that may be by investing in journalism, or by investing in education, or by investing in climate activism. Something that really takes the message away from the ivory tower and brings it out to the world. Each place that goes after one of these grants is expected to orient around its areas of interest. As you noted in the July report, there's an awful lot of climate change that comes up through infectious diseases. And so it's very easy to say, oh, you know, we've got this terrible disease and the mosquito range is changing. But what's beyond that? And what's particularly important in each place that researchers are coming to us from? That really is so variable. The health of workers depends on nutrition. The health of people in housing depends on the health of their neighborhoods. It's a big, big picture, and we want to fund people who have really thought long and hard about what the big picture around them is and what their place in it is. We don't expect everybody to solve all the problems in the world in the amount covered by a finite grant, but we want to know they're thinking big, and they're always looking for ways to expand their reach and touch other people who may have new insights for the problem. So strong proposals will bring health science and public health researchers into partnership with new colleagues. And the new colleagues have to be true colleagues, not just somebody that they're partnering with and interacting with for 5 years. but rather people who will be ongoing in relationships that help them understand the intersection of climate. And with that, I'll finish and I'll ask you if you have any questions.
Thank you so much for that. I think that is amazing. It's really explaining it's all how and how can some people or how can researchers or how can people looking for funding really put their work or jot their points or do their proposal in order to impress the funders. So thank you so much. One thing that came out is having proposals that enhances collaboration across various disciplines, and also making sure that your work is community focused, that you serve a broader public, not just within your scope. Okay, and that's why they focus on academic institutions rather than other research institutions. But again, there is opportunity for researchers to really have a slot be chosen further, kinda. So thank you so much, Dr. Victoria. I'll move to the next session. In case you have a question, kindly just feel free to put in the comment section. Doctor, you can just answer direct from the comment section, or we wait till the Q&A session so that we just have everything together. And don't leave, we'll still have a session for you under the panel discussion. Yeah. Okay, thank you. We will go to the case study presentation. This will be very brief. I'll welcome our presenters. We have 3 presenters here. We have Duncan. We have Duncan Muhereza from Reproductive Health Uganda. We also have Philimin Nyongambo from Makerere University School of Business, School of Public Health, sorry. And we have Juma Said to Sabila, also from Makerere University School of Public Health. So I'll start with Philimin. Philimin, kindly, if you're free, you have 7 minutes to do a presentation. Make it a bit quick. Yeah, go ahead.
Yes, thank you very much. Is it okay to have my slides shared from your side?
Please go ahead. Feel free to do so.
I mean, from your side. Is it okay to have them shared from your side?
And will you help on that, please?
Okay.
Okay.
All right. Thank you very much. My name is Philimin Nyongabo, and I'll just put on my video for a short while. And connecting from Uganda, I'm at University School of Public Health. And thank you for the opportunity and this conference that is being helpful. I'll be talking about raising awareness and building resilience through floods and landslides in the Elgon region in Uganda. This is some work we did with colleagues, and I was glad to be a critical beneficiary as part of the grant writing application. In the next slide, I'm just introducing to us that in Mbale, which is in eastern Uganda, the place is quite very hilly, it's mountainous, and it's quite prone to floods because they come from the highlands and to the low-lying areas, but again, it's also prone to mudslides over the hills because of number of human-led activities. But this project was aimed at promoting the preparedness and resilience, and the target group was the student communities, because the students are highly affected and rarely do people make time or take attention to help with students. In the next slide, I'm just highlighting a few of the objectives that we're able to achieve throughout the project, and basically engaging schools in Mbale City, and we're talking to them about the floods and landslides. What should they do when landslides come up? What should they do when floods start? But again, we were able to highlight the relevance of environmental health as a career, as a discipline, because many of the times you only talk about clinical sciences, and then people forget the public health sciences when people are aspiring for some of these, which I think if you talk about transdisciplinary learning, this should be something we need to highlight. In the next slide, I highlight the methods that we're able to use in this project. And we're able to engage different stakeholders in Bale district, but also in Kampala, where we got experts on climate change, experts on health, but again also experts on children's health. So able to also engage the students themselves in health education, and we can see we reached up to over 2,000 students. We also engage students from tertiary institutions on on building their resilience towards this issue. And we saw that there was quite a number of people who did not know what to do when floods start. We involve them in student-led competitions as a way of engaging them, but also involve them in tree planting. Of course, the project, we had pre and post assessment, pre and post evaluation of the project, so that we get to know how far we have gone and how far we have been successful. So from the results in the next slide, we see that we're able to reach over 2,000 students in 5 schools. So we targeted 2 primary schools and 3 secondary schools. And then we're also able to see a knowledge increase within a period of a month in terms of the students from the pre-assessment and the post-assessment. We also saw knowledge increase in how they can respond and how they should respond, which is something that we wanted to appreciate more in that. There's a lot of involvement by students in this activity, in the competitions that we had, and we gave awards to these students that won as a way of motivating them. But again, with planting trees and involving the champions, the winners of this competition, we're able to witness more and more involvement of other students all through. Even the teachers were quite involved. We engaged the head teachers, the teachers, so that there is a bit of sustainability and just more to boost the students and encourage them in continuing these efforts. Yes. So in the next slide, I'm highlighting at least some quotes we got from the teachers, and it was evident enough that they wanted actually our activities to continue. And unique with these activities that we had students from tertiary institutions engaging students in lower level or levels of education, which I think would be very good for mentorship and involving students in practicing what they are studying at different levels. Right, and in the last slide, as we conclude, it is quite very important for us to engage student communities very much in this issue of climate change and health. How much is our syllabus cognizant of these issues? So I think we need to involve them early enough so that as they grow through the stages of life, they are well conversant with the principles of climate change, with the principles of mitigation, resilience, and so on, so that we can have better decision makers in the future. And I would like to acknowledge in the last slide the different funders and the people that have helped us, acknowledge the different supporters and our mentor, Dr. Rollins, who also presented yesterday on some of the work. Yes, thank you very much, and over to you.
Thank you, Philemon. That is really impactful, and that's a great job there. Thank you so much. The next presenter is Edward. Edward, feel free to come in. Edward, if you can hear us kindly.
Oh, thank you, Lavender. Can you hear me?
Yes, we can hear you.
Okay. You actually caught me unaware. I thought my presentation was starting later on, but it's okay. Let me get started. Okay. Greetings to all. Thank you for this opportunity you've given me to share my work. And I would like to note that this is an ongoing project that hasn't got results yet. I would like to recognize my supervisors, Professor Frederick Makumbi and Dr. Lawrence Indejo. Next slide, please. This study is about leveraging disease trends in support of healthcare in Tigorombia sub-county, Hoima district in the midst of climate change. And over there, the slide is displaying the various districts in Uganda where climate change has had an impact with the health outcomes. Next slide, please. Yes, I'll share with you the introduction and statement of the problem. It talks about how the study is going to analyze disease patterns influenced by climate change and impacting public health in the Tigorombia sub-county, and propose data-driven strategies for enhancing healthcare resilience. I believe that the study shall identify trends, correlations, and solutions that can support informed decision-making and healthcare resource allocation in the face of climate variability. Next. The main objective of the study is to assess the impact of climate change on human health, leveraging on disease trends in Tigorombia sub-county. And I intend to do this within 9 months. Over there are the specific objectives and the hypothesis. Next slide, please. Here on this slide, it displays the various forms of how climate change has impacted in Uganda, where it has been rising temperatures, increasing carbon dioxide levels, rising sea levels, extreme weather. When I talk about sea level, I'm talking about well, I should have put water bodies, but I'm referring to the lakes, Lake Victoria, Lake Choga, and Lake Albert. Next slide, please. What can health professionals do? Here, as a health professional, are expected to recognize that these vectors and diseases are expanding their range, and please complete the slide, and then also be able to stay in contact with other health and vet professionals, pressurize means of health to increase surveillance and detection, investigate patient risk, and take time for participatory guidance during visits. Next slide, please. This slide is talking about the unmeasured factors in vector-borne diseases, where we've got the solid waste mosquito breeding factories in many parts of Uganda, and also we've got how the environment is intricately tied to the built space given the environmental context of our work, the governance, education, and control programs, and the support, structural factors, violence, health inequities, and poverty. Next slide, please. Over here, I'll talk about the methodology where I'll outline the variables in the study. So here I intend to use the climate variables, which include the erratic rainfall occurrence, the temperature, humidity, morbidity and mortality cases, incidence and case fatality rates of infectious diseases, malaria, cholera, dysentery, dengue, and diarrhea. Then the socio-economic factors, which include the community resettlement due to flooding and landslides. Then knowledge of science of climate change. I intend to use a mix of qualitative and quantitative study practices. Then in the techniques of data collection, I'll use to focus group discussions, key interview formats, and observation and secondary data analysis. The area is in the western part of Uganda, in Hoima district. It's referred to as Tigorombia sub-county. Now for the data source and collection, I intend to collect data from the FGDs and KIIs using digital voice recorders. Thereafter will be transcribed and translated into English. The transcript shall be read through several times by myself and other people I'm going to be working with. Verbatim statements about the participants' experience shall be extracted and compiled into an Excel for each region. Maybe I need to note out that I'll be getting secondary data from DHIS2. This is the national database program which is hosted at the Ministry of Health, Division of Health Information. And I also will get climate data from the UNIMA, which is Uganda National Meteorological Authority. Next slide, please. In the irrigation techniques, there will be I'll be able to analyze the disease dynamics in context of climate change and how the variables can influence disease prevalence and healthcare outcomes. Over there are the ethical considerations in the pretest pilot study. Next slide, please. Impact of undertaking the study on climate change and health in Hoima district. There will be sufficient information on sanitary facilities and hygiene. There will be the outbreak preparedness and response mechanisms, sufficient weather information, and reliable early warning systems to local communities. Findings shall act as a strong basis for improved planning for effective preparedness and response to climate change in the district system. Next slide, please. Over there are the references that I'll be using. Thank you for listening to me.
Thank you, Edward. We're really looking forward to seeing the final output of that work. This is really commendable and is a good job there. Thank you so much. Without further ado, I'll welcome Juma. Juma, please. The floor is yours. Go ahead. Anne, you may need to put it, or Juma, put it, okay, go ahead.
Yes, I hope you can hear me.
Yes. We can hear you, Juma, go ahead.
Yes, my name is Juma Said Tusubira from Makerere University School of Public Health, and I'm a student of Master of Public Health Disaster Management. And I want to start with a story. When I was about 8 years, I was run over by a car and I had to be hospitalized for a full year. I was taken to the best hospital that was almost at the level of a regional referral in orthopedics, and that was the Klembe Mines Hospital. It was such a beautiful place where I would look at the mountain, and I believe facilitated my healing. In 2013, a flood swept through Kasese town and went through Klembe Mines Hospital. Part of the hospital was destroyed, but some of it stayed. In 2020, the flood came and finished what it had started in 2013. What lingered in my mind was, if a hospital that is well established to the level of a regional referral like the Mines Hospital can be swept by a flood, what is the story of other health facilities in the face of climate change? Studies in Kasese have shown that between 1966 and 2018, Kasese experiences about 4 flooding events in here, that's specifically in the Nyamwamba Valley. But in the recent years, we've been having about 6 flooding events within the same month. That is in 2020, 2022, and the recent years. So therefore, that's what led us to conduct this study. And generally, the objective was to see the current state of preparedness of health facilities to respond to impacts of flooding on community health. And we focused on flooding as a small subcomponent of the wider context of climate change. And here we're looking at the level of preparedness of health facilities, factors that facilitate or hinder preparedness, and the perceptions of health workers. So we went to Kasese district, which is in the western part of Uganda below the Rwenzori Mountains, one of the most flood-prone areas in the country and one of the areas impacted by climate change in Uganda. We used both quantitative and qualitative methods to collect our data. And we went to the most flood-prone sub-counties, and we studied 43 health facilities, interviewed 43 health workers who are directly in charge of emergencies. And we also interviewed district stakeholders as key informants. And then we went ahead to analyze our data. So from our results, we found that more than 1 in 3, that's 35% of the health facilities in these sub-counties we studied had flooded in the last 5 years. And when we went to probe on the preparedness to respond to flooding, none of the health facilities rated themselves as completely prepared for major flooding events. And so we looked at preparedness, both quantitative and qualitatively. So quantitatively, we looked at other domains of preparedness. And the worst, where we saw this performance was in leadership and financing for the domain of leadership and financing. And then the domain where there was some slight, where there was a general preparedness that was significant was in service delivery, where 28 out of 15 of the facilities had some, where they had some substantial level of preparedness. And service delivery had things to do with deployment of mobile units when there is a disaster and things like that. When we went to perceptions, we found that majority of the health workers had heard about climate change, and many of them knew exactly what was bringing climate change. They attributed it to deforestation. However, when it came to other trends such as diseases in the face of climate change, the numbers were reducing, so that less than half of them could actually see that diseases were going to increase in the future. What encouraged us, however, was that many of them perceived that health workers have a role in disaster response in the face of climate change. However, less than 14% had ever been trained on climate change or topics related to disaster in this flood-prone area. When it came to barriers and facilitators, one of the major facilitators we found was community engagement. However, the barriers were on human resource capacity and training. We also had inadequate infrastructure, and also there were challenges in logistical coordination as the major barriers of preparedness of these facilities. So from this study, our main point that we could say in summary is that health facilities are vulnerable to climate change impacts, but they lack readiness to respond to these impacts. Therefore, this means that health facility managers, local government, Ministry of Government of Health, and other partners need to strengthen the capacity of personnel, infrastructure, increase funding, so that if these health facilities are to indeed help the resilience of the communities where they exist. So this is part of our call to action from our major conclusions. And really, we really desire that the Ministry of Health can take a role and acknowledge the issue of climate change, bring it into curriculums of institutions training health workers, but also retraining health workers in many of these facilities. But also facilities in disaster-prone areas need additional funding to meet the emergency medical supplies. But even the health facilities themselves can organize themselves to have focal points for any emergency and also develop plans. And in terms of research, we feel that if maybe we could have this kind of study done in wider areas, it could help to bring up a better story concerning the preparedness of health facilities in the face of impacts of climate change. I would like to thank my Professor Chris, who has been my supervisor, and also the Climate Adaptation Program, which is funded by USAID through the University of Arizona and through the Peru network of universities housed by Stellenbosch University. Thank you so much. That's a picture of me when we were in the field. And this is the bridge that links that part of Clembe Mines to the side. And remember, when there is a flood, this whole place floods from that bank. So in any way, this is some of the impacts that we saw in the field. Thank you so much.
Thank you so much, Duncan. Sorry, Juma, that is Juma. Thank you so much, Juma, for that. That is a good presentation. That's a good research there. And I'm very sure if the call for action is those recommendations that you've just put there be put into real action, the impact will be grateful, and such can be even replicated in various countries or regions experiencing the same. Thank you so much for that. Our last case study presenter is Duncan, if I'm not wrong. Duncan, if you're here, kindly go ahead. You have 7 minutes.
Okay, good afternoon, everyone.
Good afternoon. Feel free to put it in slideshow.
Okay, so my name is Duncan and I work with the Reproductive Health Uganda. Yeah, this project is about the implications of floods on women's access to sexual and reproductive health services. And Juma has shared, of course, the same study area and how floods have impacted health facilities. So for me, it is going to be much easier to connect and show how especially women are affected in terms of their access to sexual and reproductive services. Of course, if anyone has been in this conference, really now can and climate change can impact on health, especially when you look at an element like floods, how they have affected individuals, and studies have shown that they have impacted about 2.8 billion people. But the main focus for me, it is going to be how they have, for example, damaged health facilities, damaged medical supplements, making it hard for medical health workers to access health facilities to provide services to the communities. And we also looking at women, especially the pregnant women, how they are vulnerable, of course, in terms of their physiology, but also now if they are exposed to some of these disasters and they cannot access facilities and supplies, then the situation may really be worse, affecting themselves, but also their unborn babies. So the study focused on bringing out the specific challenges, barriers that women face during flood events in terms of accessing their sexual and reproductive services. And those are the objectives. One was looking at the impact of floods on women's access, but also factors that affect access to sexual and reproductive services, but also looking at adaptation strategies at different levels, individual, community, but also national. And the methodology, of course, the study was a triangulation looking at the Kasese municipality, its 3 divisions, and of course, the survey was done in 201 households, but also integrating focus group discussions and key informants. And the results, of course, show that among the impacts of floods, the ones that were significant was destruction of health facilities, disruption of outreaches, realize that partner organizations and government conduct health outreaches to reach out to communities, especially those that are isolated by disasters, but also those that are in hard-to-reach areas. So a disruption of health outreach delivery was significant to impact on access to sexual and reproductive services. Then the last one was the impact on privacy, dignity, and security. When you look at the component of sexual and reproductive health, it is a sensitive area where especially women require privacy, require confidentiality to access sexual and to access services. So a disruption of facilities that could accommodate or give make it easier to provide services in a confidential manner really disturbed women to access their sexual and reproductive services. This picture right now, it is familiar. These floods, like Juma earlier shared. So I already mentioned about the impact that were significant, and if you can look at the significance level, it is very clear. And of course, when you look at also some of the things that came out in the interviews, we can see how they were sharing, how destruction of the hospital impacted in transfers, because Kilemema's hospital had a ward where they were supporting. So that that impact that requires a very fast response, of course, affects how fast do you get ambulances to transfer people, and where are these patients transferred to. So there was chaos, and of course we can see someone who reported a loss of a baby because the response was really not adequate. This is a picture of an IDP camp, internally displaced persons in Kasese. You can look at the situation, and of course you can imagine a pregnant woman in this setting, a breastfeeding mother in this setting, a woman who is in menstruation in this setting, how they can really be able to support themselves, but also address their sexual and reproductive needs. So in terms of the factors that affect access, the two factors that were significant among the many that were studied were financial difficulties that women face. Of course, we know the financial difficulties that women face in terms of accessing resources like land, like other assets that facilitate economic activities and production. Then also the level of education, it was also significant. Looking at some of the services like cesarean sections where they need someone to consent, but now you need to understand the terms and conditions, but also looking at other services that require some of the prescriptions, and a patient has to follow and understand the prescriptions better. So an element of level of education can really interfere with how these women, especially the rural communities, the rural women, can access their sexual and reproductive services. This is a mother in an IDP camp. Because of the environment, the social cultural factors, she's carrying a baby, she has to fetch water, and looking at this setting, you can imagine how she really has to address her sexual and reproductive needs. In terms of adaptation, the adaptation strategies were quite a number that were mentioned, but I was looking at different levels, individual, community, and national. So briefly, when you look at divisions that are more urban, the adaptation strategies are quite different from those divisions, the areas that were more rural. So in this, the results indicated that the adaptation strategies are interdependent. They are dependent on the communities where the respondents came from. For example, in simple terms, it shows that a one-size-fits-all approach in adaptation cannot work. You realize that, for example, in Central Division, that adaptation strategy, stockpiling was the dominant, because this is more of an urban area, so where women can access pharmacies and maybe stockpile. But when you look at a division like Kiblembia, you realize that for them, in terms of the adaptation, we are relying on, say, self-care, In Nyamwamba, you can see that people were also relying on self-care, but also you realize that the adaptation strategies differ, of course, depending on different characteristics that the communities really have. And of course, the key messages from this study is that one size fits all for adaptation really does not work. Each community has its own characteristics that really has to be studied and addressed. And of course, these factors that became significant, like destruction of health facilities, disruption of outreaches, interfering with privacy, dignity, and security, financial difficulties. These ones need to be addressed, of course, through government and the partner organization. And this study recommends that Ministry of Health should come up with the interagency reproductive health contingence field manual that includes a minimum initial package for women, especially in unforeseen disasters. So when there is a response, this manual can really advise. And maybe future research can also look at impact of floods on maternal and child health outcomes, because this is one of the key component of sexual and reproductive health that was dominantly reported to be impacted. And in conclusion, I want to thank you so much for the opportunity to present here and share knowledge. And I hope this is going to be impactful. Thank you so much.
Thank you so much, Duncan. That's really impactful as well. Thank you so much for that amazing, well-elaborated presentation. I can see when Dr. Ariel has said something in the comment section that is really good. You've added the data disaggregation of the gender, and also she's just trying to tell other presenters or other researchers, try to also integrate that to understand specific context of these sections, or even to understand your research well. So thank you so much, everyone. Thank you, those presenters. Those are really good work out there. Amazing. At this juncture, I'll welcome Dr. Atela to officially launch the State of Evidence report on climate change and health in Africa. Dr. Atela, the floor is yours. Dr. Atela, if you can hear me.
Yes, I can hear you, Lavender.
Okay, go ahead.
Yeah, so in the interest of time, in the interest of time, I guess I'm just going to quickly outline what the purpose of this report, State of Evidence Report on Climate Change and Health, is all about, and try to just highlight the plans that are there for the report. Now, the State of Evidence report focusing on climate and health in Africa has built on work or a study that we have been executing to look at the landscape of climate and health research, policy, capacity building, and funding in Africa. And it came out quite clearly in that particular study that there is very critical need to understand the evidence needs that could support the political ambitions towards integrated climate and health actions. As all of us are aware that the global community, through the ATACH framework that was established through the WHO, there has been a very strong pursuit around bringing health the center of climate change decisions. At COP26, a number of countries subscribed to the ATACH framework. Within that framework, the expectation is that countries are to develop what we call the healthy national adaptation plans. And within those health national adaptation plans, the expectation is that there's some, vulnerability assessments and a number of analyses that needs to go into that. Now, the big question that this particular study tries to answer is that now that we have the political ambition and the goodwill that there's need to integrate health in climate change decision. In fact, in COP28, we actually saw that almost about 60 ministers for health basically were participating in the climate change negotiations for the first time. Now, that symbolizes a very strong political goodwill on the connection between these two fields, which for a long time has been a bit weak, as I said in the beginning. Now, while there's the political ambition, which is growing, and the policy ambition with the HNAPs, the big gap that we found out in our landscape analysis is the lack of integrated or transdisciplinary evidence that could inform these integrated national policies that are actually building from the global policy agenda. And therefore, talking to different stakeholders, we were requested, and there was a demand that we need to know what the current state of evidence is with regards to climate change and health, but also with specific focus on transdisciplinarity. So this particular study specifically looked into what studies exist on climate change and health, which topics have been given a lot of attention, what are the main findings that are coming out of these particular studies, and in what ways are transdisciplinarity being addressed within those particular studies. But fundamentally, the report is also looking at what we call the knowledge gaps. What is the evidence gaps with regards to transdisciplinarity, so that even as policies build in integrated ways, we need to then support that with adequate research and evidence that really can then support these particular policies. So this study also really unpacks and presents a very robust perspective about some of the critical research questions that are fundamental and necessary to really support the policy momentum. So I want to say that that is the gist of the report. It is currently in the final phase of editing and proofing, and we should be able to launch it immediately after the COP29 that is currently taking place in Baku. We do expect that some of the outcomes of the COP29 will actually be reflected in that particular report, or the report will be a reflection on how to take the decisions from COP29 forward. So thank you so much, and we look forward to having you when we have a good time to really launch the report thoroughly and get your engagements, because I think with the time we have now, we might not be able to say as much, but there is a lot of interesting things that has come out of that report that I think the world needs to listen to if we are truly passionate and committed to the element of transdisciplinarity and integrated climate and health solutions in Africa. Thank you.
Thank you, Prof, for that good, well-put report. We're all looking forward to reading it and actually understanding what really needs to be done differently in order to improve, or rather, focus on the level of evidence that should be integrated in the policies that we are looking at, or even the decisions in the climate change and health space. Thank you so much. All right, so at this point, we're going directly to our panel discussion. I think this is what we really been looking for. We have amazing panelists here who will be taking us through the tackling various questions related to our topic of today or for today. So our first panelist is Dr. Victoria. I'm coming back to you. I already introduced you. What strategies can be employed to increase and diversify funding for transdisciplinary climate and health research in Africa? Kindly just feel free to unmute, and you've talked about the funding, we've talked about what really needs to be done. But again, we need the innovation aspect. What strategies can be employed to increase and diversify this funding? Dr. Victoria, over to you. In case you're talking, you're on mute. Dr. Victoria, can you hear me? Okay. I don't know what's the problem. I can see her here, but she's not saying anything.
No, here I am. I was in a different screen.
Sorry, okay. Yes. Did you hear my question?
No, I didn't. I'm sorry.
Okay, I'll just repeat it. We've talked about the funding. We've talked about how researchers can leverage on whatever is there to enable them access this funding. And one thing that really needs to come out clear in the aspect of transdisciplinarity in climate change and health is the innovative aspect. So our question today is, what strategies can be employed to increase and diversify funding for transdisciplinary climate and health research in Africa?
I think that probably the best question is to not to try too hard for the questions. Think about what are the ones that actually affect you the much, because those are the ones that you have the most creative stories for, and the ones that you have the best solutions for. Does that make sense? I mean, don't try to be cleverer than your neighbors or cleverer than somebody in some other place, but come up with, here is the thing that would make all the difference in my life or my neighbor's life, and propose that. And I think that kind of thing, actually, it's good advice for research, I think, in general, because the problem that's closest to you, that you understand the best, is your own problem, and nobody is going to outcompete you from your own problem.
Yeah. I can't hear you. Sorry if Doctor, we can't hear you.
Oh, is it muted?
Yeah.
My screen shows it's not muted.
Now we can hear you. Go ahead.
Okay. Did you miss everything I said?
Partially.
I said, did you miss everything I said? It was brilliant. I don't know. No, my answer, I think the best thing to do is to think about the question that's most of interest to you, most local to you, because that's the one that you really have true insights to, and the one that nobody else can take away from you. Nobody can put you on your best problem. And you know, don't approach research trying to come up with something that's cleverer than everybody else, because clever doesn't get you very far. What gets you far is real problems, especially now with climate and health, to think about what's the most needed in your backyard, and what are the problems in your backyard that you could actually imagine how to start funding. I mean, how to start taking care of. There will be problems that, you know, you just say, wow, that's a hard problem, and I'm not going to, you know, that you don't know even where to start. So for problems like that, you sit and think and talk to people. But for some problems, it'll be, you'll see answers that you can get at, and just start going for those. Does that make sense? It seems like a very simple answer, but I think sometimes people get very fancy when they're thinking about funding.
Okay, so it's about being unique in your own ways and trying to be you.
Yes, and don't worry about being unique, because don't think, oh, I'm going to be so unique. I'm going to be that perfect crystal on the shelf, because who you are is just fine, and the problems closest to you are probably really interesting ones.
Okay, thank you. I don't know if there's anyone who have any other addition or any other question. Otherwise, I think that's direct, or whatever you need to do, whatever strategy you have to employ is to be unique, and yeah, do you solve your own problem in your own ways? Okay, not unless I didn't hear that well. Okay, our next panelist to discuss the next question will be Dr. George Mwaniki. Dr. George Mwaniki is from World Resource Institute, country representative of Kenya, head of air quality in Africa. He's based in Nairobi, and he leads stakeholder management and efforts to improve air quality across Africa. Formerly, he was a climate finance consultant, and he supported several African countries and served in UNEP's lead consultant on air pollution. So Dr. Mwaniki, in case you're here, please, how can we reinforce principles of equity and ethics in allocation and management of climate and health funds to ensure fair distribution and accountability? Dr. Mwaniki.
Thank you, Ravada. That was a fantastic question. And also, I'd like to really say I really enjoyed the answer from Daktari. It was quite straight and to the point, which was quite lovely. Now, on issues of climate finance, I've been working in this sector for a long time. The more you work on the sector, the more disappointed you get, and the more heartbroken you get. Because most of these resources do not go to the people who need them the most. If you look at the climate finance flows into these continents, I think we are meeting probably 11 to 15%, comparing it to the need. If you dig deeper and look at what percentage of that finance is going really to address health-related issues that emanate from climate change, you actually get even more disappointed. I think it's less than 1%. And this is not something to blame to the policymakers or people who do climate negotiations in Africa. But also you realize in the global perspective under the COP system, the first time really climate and health issues were brought strongly to the forefront was during the Paris COP. And then last year, we saw a little bit more discussions of the linkages between climate and health and the need to support issues emanating from climate and health. So this has been an issue that, for the most part, has been ignored, especially in this part of the continent, despite its relative strong need for it in terms of early warning systems, in terms of making sure that our health facilities are resilient enough to withstand these kind of challenges. And also, more importantly, I think 2 weeks ago I was in Makueni, and most of the rural counties are not connected to the power sources, and they're trying to encourage investments in renewable energy sources to supply the health facilities, which most of them are not connected to power, which is also, even if it's not climate per se, but introducing renewable energy sources as a solution towards these health facilities for them to be able to store their vaccines for longer. Those are very, very big issues that for the most part are quite ignored. If you look at this continent right now, we are experiencing some very serious droughts in the Southern Africa region, and which are mainly driven by climate change impact. What does that mean in terms of nutrition availability, food security for the people? And not just looking at the direct impact. When you look at the indirect impact, when there is
droughts and those kind of challenges where now people have to spend more money for food. What does that mean in investments or the money that they allocate for their own health, and also reducing the exposure to health? In my experiences, when we have such big droughts, you see a huge population move back to the use of wood fuel for indoor cooking. If you look at the data from Nairobi and many other cities in Africa, when the COVID pandemic hit, most people were locked down, the economic activities were reduced, and then that actually led to a lot more bigger population transitioning back to the use of wood fuels, which have a huge impact of indoor pollution, which also translates to poor health. And most of the people who are kind of hit by these events hard are usually the bottom of the pyramids, people who do not have economic capacity to withstand these challenges, which means climate and health. We can just look at the health impacts of climate that we've been discussing for the last 2 days. But also there are some impacts that are not directly linked, but are quite strong in terms of health implications. For example, if you look at Nairobi, which I believe is the same case across the continent, around 33% of the health budget for the city county goes to address issues of upper and lower respiratory diseases. And when we have those climate-related disasters in the city and affect the economic activities for the most vulnerable and poor, then those people move lower in terms of maybe cooking fuels, and that does impact their health. If you look at most of our cities, again, I'll give an example of Nairobi. We do have those very periodic outbreaks of cholera. Every time we have a major flood, we have outbreaks of cholera in the city. And if you happen to engage with the health department for Nairobi City County, you actually realize very few of those stories get their way to the mainstream media or to most population. But these cases are quite serious, and they're occurring over and over. Again, if you think about issues of heat-related stress, in Nairobi, when you just walk across a few kilometers outside the city, not even kilometers, a couple of maybe 100 meters, you experience a temperature drop of around 7 degrees. And this does have impacts on how it affects people within the city, people who cannot have air conditioning in their offices, people who do not have ample living spaces. If you go to most informal settlements in Nairobi, they're usually made of tin or iron sheets. And you can imagine what that means when we talk about the heat stress. So when the outside temperature is high, the indoor temperature for those kind of housing can go a couple of degrees higher. So we are talking about climate and health, but the most impacted people in our community is actually the most vulnerable and the most poor. So when we are talking about justice, ethics, equality in climate finance, we have to think how do we pull the marginalized in our communities, how do we make sure that some of these climate flows really supports them to build resilience. Early this year, we had those very big floods in the city again, and several cities across Africa. I think in Rwanda and also Burundi, they experienced these floods. The most impacted communities, again, communities living in the formal settlements. It does have some level of historical aspects. I remember personally visiting these communities after the floods, and you can actually see there is some level of mental or kind of stress and depression because their houses were washed away, everything they owned was washed away. So they are starting afresh from the ground. If you think about what was the government's response, the government's response was we need to create a buffer zone. We need to reclaim the riparian zones. And what did they give these people to look for alternative houses? I think it was like $60 per person which is not even enough to feed a family of 3 or 4 for 3-4 days. So when you talk about issues of climate health, issues of justice, equality are the central part of it. And for us who are in the development space and trying to push for reforms and creating resilience for these people, that the consideration for equality has to be at the center of our discussion. I'll stop there. This is an issue I'm very passionate about. I can talk for 2 weeks about it. Thank you.
Thank you, Dr. Shari. Thank you. That is very well elaborate. Looking at the issue of equity, justice, ethics, the one thing that should come out clear is how do we support the marginalized? How do we support the most vulnerable who are really highly impacted with this issue of climate change and health? And also in terms of resource allocation, how much are we giving these people? So that is well put into consideration. I think we will capture that well in our reports. Thank you. Okay, moving on to the next panelist. We will, just a reminder, in case you have a question to any of our panelists, feel free to put in the comment section. Our next session will be on Q&A. And yeah, we will look into those questions as well. So our next panelist, and probably the last, is Dr. Yawande. Dr. Yawande Alimi is from the Africa CDC, is a doctor of veterinary medicine from the University of Ibadan. He also has a Master of Public Health, graduate from the University of Nottingham. He leads one of the health unit in Africa CDC. He's also a co-lead of the Africa Union Task Force on AMR, and she spearheads initiatives addressing antimicrobial resistance, zoonotic diseases, and even climate change. So Dr. Alimi, what approaches can optimize coordination mechanisms such as funders consortia to ensure sustainable and impactful resource allocation beyond the scope of individual projects?
Thank you very much. And thank you so much for having me. I think the organizers had suggested to have a bit of presentations. So very quickly, I will try to talk a bit about our work in Africa CDC and how we've been able to optimize coordination mechanisms for sustainable resource mobilization for climate change and health in the continent. So I'm sure, ladies and gentlemen, over the past 3 days, you've had interactions with what One Health is in terms of the context of climate change, particularly trying to tie climate change and health together. So I would not really go into all of that, but really to paint a bit of a picture is that Africa, being the least contributor of greenhouse gas emissions, is suffering the highest impact of climate change, particularly around the health challenges. As you know, a lot of our health systems face critical challenges, be it overwhelming zoonotic diseases, infectious diseases, non-communicable diseases, and many of these African countries have limited resources. So really tying it down from the Africa CDC perspective, we've really put together 4 key priorities when you think about One Health, and a multi-sectorial approach and thinking about the priorities. And if you look very closely, if you look at the first 3, zoonotic diseases, AMR, and food safety, you see that, and if you think about the science behind it, you realize that climate change continues to drive the burden or the impact of these 3 critical areas. So climate change, whether we like it or not, becomes a bit of a foundation, is that whether we like it or not, we are racing against time, looking at the impact of health, environmental degradation, extreme weather events, and the impact on health. So at Africa CDC, what did we think about doing? It's like, how can we then focus on critical areas whereby we can see the impact? And we call this moving the needle for climate resilient health systems. Think of it in this way. Whether we like it or not, El Nino events will continue to happen. The hurricanes, the tornadoes, the cyclones are happening. There's literally, it's almost impossible for us right now to reverse those extreme weather events. So what can we do in terms of building stronger, resilient health systems? It's really to focus on areas where we are seeing the burden on the African continent. And this is what we have tried to do at Africa CDC. And some of my slides will further talk about this area using a One Health approach. In terms of resource mobilization, I'm sure that many of you know the Green Climate Fund and several other funds and the significant amount that is going to climate related projects. But if you think about it, up until last year, that interaction between climate change and health was very kind of a bit silent. Our political leaders, the African continent, we weren't really talking about what climate change was doing to health systems on the continent. So last year, 2023, at the first Africa Climate Summit, which was one of the biggest political moves our heads of state have made, coming together to really identify the impact of climate change, we were really able to put health on the radar. But beyond putting health on the radar, I think it's important for the continent to look at the impact, the specific challenges around climate change and health, and where the needs are to be able to make a case for sustainable financing and investment in these areas. So at Africa CDC, we've been looking at 4 crucial elements. This is one, really having a continental strategy that anchors the work that we will be doing and we'll be supporting our member states with, but also building strong partnership engagement. And I think some of the works that I'll be describing are as a result of some of these partnerships. For example, the partnership of Africa CDC and Rockefeller, the Team Europe initiative under the European Union Global Gateway project, and several other initiatives that we are putting together. But beyond that, we have anchored it to things around building the capacity for Africa's sort of workforce to be able to address the issues of climate change. And lastly, paying forward and ensuring that we have young Africans to be able to drive this initiative. I think we can all agree that young people have been sort of the nucleus of what climate change conversations look like, and they have a significant role to play, and we as health experts cannot afford to miss them in this conversation. So very quickly, I just wanted to describe what we are doing in terms of optimizing this approach to be able to mobilize resources to come to the African continent through the strategy. We're coming up with a climate and health framework that really guides what Africa CDC, being the foremost public health agency of the African Union, can do for its member states. And of course, we're doing this in consultation with our member states. So we've had 2 consultative meetings in the past 2 months to try to define where the priorities should look like for the continent, but most importantly, how we can have a framework for resource mobilization. So really putting it nicely, this is where some of the priorities will look like. And this we have done in consultation using a defined set of criteria to define where our priorities should look like. But ladies and gentlemen, I think the most important bit of this is understanding that climate change cuts across several sectors, several ministries, and we need to think of a collaborative way. This is the One Health approach to be able to address this shared threat. So in terms of where the priorities are, this was developed with the technical experts, researchers from member states, as well as partner organizations. And this is where our strategy is going to be looking at. And we have already started the resource mobilization phase of trying to get this in place. So beyond that is to look at how can we ensure that we're able to build resilience and adaptation. And this is looking at critical issues to the African continent. For example, our health systems, how do we ensure that things like wash and health waste management are adequately improved? We know very well that there's return on investment and economic investment for early warning system to reduce the impact of climate change and health and what the disasters could look like or outbreaks could look like. But most importantly, how can we ensure that we can strengthen our health system to better respond to these emergencies? Research and innovation becomes critical because this is how we can create innovative solutions for Africans by Africans. Means that we can do a context-specific sort of research agenda that addresses the needs of the African continent. Of course, advocacy and awareness, particularly around policymakers, the communities, the public, is really important and crucial. And lastly, is around partnership and collaboration. So one of the highlights for one of the works that we're doing around partnership is really the joint emergency action plan, the collaboration between Africa CDC, WHO, and UNICEF. And we have now a technical working group that really looks at climate change and health. And all of our 3 organizations are going to be working together to be able to support member states focus on this following activities. Now, this is an innovative way for all agencies to come together to be able to raise resources to address climate change on the continent. Like I rightly highlighted, we are very keen to ensure that we are able to scale up what youth support initiatives are, because they are the ones to carry on the torch, help us engage better with the community, but also raise a value for investment towards climate change and health. Lastly is on building the workforce of health experts across the continent. I think this is an example of global collaborations, because we did this with the University of Columbia, and this is one of the first Africa climate change and health responder courses. And we've had participants from over 131 countries outside even Africa, which has been very useful to the continent. Most importantly, for us to be able to carry on a sustainable implementation of any plans, it's really to build the workforce on the continent. Ladies and gentlemen, it goes without saying that strategic partnership and engagement is really necessary for resource mobilization, particularly on this subject area. And these are some of the examples that we have worked with across the different global stakeholders in terms of the work that we're doing at Africa CDC. Lastly, I think is to say, why should we take a One Health approach? It goes without saying that if you understand the way climate change and health are interlinked, you realize that it's no one sector, no one discipline that can address this issue. Therefore, we need to use a One Health approach to be able to attain the right health outcomes for people, animals, plants, and the shared environment. Today's health threats really requires a multi-sectorial response. Africa is blessed with a rich biodiversity, intertwined with expanding human population and expanding agricultural practices. Whether we like it or not, we have a complex ecosystem. This complexity increases the challenges our health systems will face. In summary, no one single sector can address all these issues. And for us to effectively respond to this risk, we need to take on a collaborative, multi-sectorial, transdisciplinary approach and leverage this and coordinate resources from multiple sectors and various stakeholders. Thank you very much for having me, and back to you, Lavender.
Thank you so much, Dr. Alimi. Thank you so much. That was really amazing. We need to leverage on resources. We need to have the strategic partnership and strategic partnership and engagement, which is really important for resource mobilization. We also need to focus on key critical areas where we see the burden, and also have One Health approach. Okay, that is really helpful. At this juncture, I don't know if we have Dr. Andala, Professor Andala, sorry. I really don't know if you have Professor Andala with us. Just in case you are here, let me know. Meanwhile, I'll welcome Dr. George. I'm told there's something missing. Kindly feel free to share your screen and make the necessary additions. Dr. George?
Thank you, Raveda. I think what I shared before was really my quick look at issues of justice and equity in the climate space. But I've been told I can spend a little bit more time to dig deeper to some of the questions that I left behind. So I'm sharing my screen for you to be able to follow the discussions. So mainly we are looking at how reinforcing equity and ethics in climate health fund allocation. And because of my background in the climate finance space, I'll dig a little bit deeper. So this is one of the most commonly used figures to describe what equity is. Equity is providing an opportunity for all of us to be able to enjoy our lives equally. So for those who are more able, they can create room for those who are not able to also participate. But when we talk about ethics, it becomes a little bit more complicated and non-linear. It brings issues of integrity, morals, honesty, fairness, responsibility, choice, honor, all those things are captured under ethics, and how we consider that in climate finance and also in climate and health finance is quite complicated. And I'll share some of my experiences across the continent that I came across when I was doing the climate finance work. I also thought it is good to share some of these figures on climate finance. So from this figure here, we are looking at climate finance flows in Africa up to 2023. This is from the Climate Policy Initiative. They have done some very good reports on how the climate finance is flowing. And this does not only include, this includes the entire climate finance, both mitigation, adaptation, and I think from my previous comments, I indicated that climate and health finance flows is almost negligible in this part of the continent. So from these numbers, the biggest needs are mainly in the Eastern and Southern Africa region, while East Africa does receive a bigger portion of climate finance flows in Africa, but still way below what is required. The Southern Africa region receives the least of climate finance. I think in those 5 years, they received around $2.2 billion. And the next figure here is actually showing issues of equity and equality in climate finance. So the red colored countries indicate that the 10 most vulnerable countries to climate impact. And the green shows the top recipient of international climate finance in Africa. And you can see the top recipients of these funds are actually not the most vulnerable, except for Uganda. So countries like Eritrea, Somalia, Sudan, Chad, Niger, Mali, these are quite vulnerable countries. They experience some complications in the political space, in the environment space, which means if you look at the climate finance landscape, for you to access those financing, the kind of capacity you need in country to design and develop those kind of projects and develop the proposals. Some of these most vulnerable countries do not have that capacity. But don't be misled by the greens. Most of the climate finance flows in Africa, they're usually flowing through these international organizations, the UN agencies. And if you really look deeper in terms of how is that money distributed, how much of that money reaches the ground, the most vulnerable people. I would say the number, if you see a project that 25% of the money is reaching the ground, in terms of projects that are sustainable, please let me know, because that would be a surprise. This is just another way of looking at that figure in terms of the dark green is the flows, and the light green indicates the total needs for climate finance. So the Southern Africa region, and this is based on the NDC only. Once you look at all the reports that these countries submit to the UNFCCC, the need is bigger than you're seeing in this figure. So for NDC support only, if you look at Southern Africa region, this is the 11 countries in the Southern Africa region. The total request is $110 billion, and they were able to receive around $2.2 billion. In East Africa, where we saw a lot of green colors, again, the total need is 82 billion, and they only received 10 billion. And the rest, you can see the figures there. So we are not even meeting 10% of the climate finance that these countries indicated that they need. So if we are to double down our efforts of mobilizing these finance, why should we incorporate issues of equality and equity and ethics into it. I think equity, as to start with, is fundamental for making sure that this climate finance is effective and it goes to people who need it most. I think in my previous comments, I indicated that the people who are most vulnerable and people who need this support, in most cases, they're not getting these funds. And also, most of these people are also the least responsible for contributing to climate change. So the issues of injustice in climate finance is quite evident when you look at climate finance flows. But also ensuring that equitability is there also builds some sense of transparency in how we allocate these funds. We should be able to know you received $10 million, how much of that really was invested in the communities that need it most. But more fundamentally, one of the biggest challenges you see in the climate finance space, most of those projects and mobilization documents, finance mobilization documents, they're usually designed by a team of experts seated somewhere in a big office, and they determine what is needed for the most vulnerable people. You rarely see people going to the ground and kind of engaging people to really understand what are their needs. And if that happens, and I liked the comment from the speaker from Wellcome Trust that said, if we are able to connect with that issue, that is the real issue that we are looking at, whether it's complicated or not. So some of these projects do not have the lived experience into it. And sometimes it's people who are evaluating these projects are usually from the global north, and they don't have a very good hand or a whole of what's happening in Africa. One of the things I like saying, Africa is not underdeveloped Europe. Africa is a whole new ballgame, and we have to give it an approach that is reflective of the African needs. And these are some of the comments I made earlier on in terms of climate and health discussions in the COP. This was first introduced in COP21 in 2015, and it was recognized in the Paris Agreement. If you look at the NDCs, mainly from Africa, the issues of health are captured minimally. I think only a few countries, I had an opportunity to look at all the NDCs from the 54 countries in Africa, and the number of countries that mentioned health issues in the climate space were quite minimal. Again, in COP26 in 2021, I think the COP launched the health programs with 50 countries committing to start initiative on climate resilience health systems. How far they have gone on this, there is need to evaluate that and see what are some of the challenges and how we can support them. And then in COP28 is where you started seeing a more effort, more discussions on and creating more emphasis on climate and health resilience. In COP29, which is coming up, we are expecting to see a lot more advocacy for health inclusion in the climate discussions. These are some of the challenges that I think this particular conference, which I have to commend ARIN, this is a very timely discussion. These are some of the issues that were discussed, and I'm really looking forward to seeing that report Dr. Terra just gave us a quick snapshot of. I'm very curious on what's happening in this space. I just wanted to share this story of my mahio because I was personally impacted. And if you know the story of my mahio is a town in Kenya that experienced some very serious floods. I think it was April this year. And more than 260 people passed on. Although when you look at the media, the number is around 77. This is one of the issues that created. I had families who are impacted. I had one family of 7 that 6 people died and 1 person was left. If you talk to that person today, which is a distant cousin of mine, you realize there is a lot of mental illness that's occurred from this particular flood. So issues of mental health and climate change also need to come to the forefront. If you experience this kind of loss because of certain catastrophic failures that are driven by impacts of climate change, how do we design these kind of ideas on how climate finance flows? How does it support those kind of people? And these are some of heartbreaking issues that when you talk about climate finance for climate and health issues, I think we talk about it as if it's an academic question. But when you go to the ground, you see the impacts of this and what kind of supports are being provided to these people. I can tell you for free, in this Mayu incident, the government went there for 2-3 days and then they pulled out, and everybody, the communities there were left to fend for themselves, and they're not receiving the kind of support that they need. And sometimes when you say support, people think is support to support your livelihood, but also mental health support. So why is equity and ethics important? Equity issues do ensure that resources reach the people who need them, and this enhances transparency and accountability. Issues of or challenges of climate finance access. Again, if you look at this money when it comes to the continent, who benefits and who loses? Those are very big questions, and I hope there can be an institution that does kind of research on this. Sees when this money comes to the continent, who are the real beneficiaries, and does it go to the people who need it most? And the people who need it most, in most cases, are the people who have contributed the least in the climate change or in contributing to climate change issues. So we need to think about inclusivity, fair fund allocation, and I think these are big issues, and I hope in one of the COPs we talk about how these funds are allocated to driving meaningful resilience to the people who need it most. Some of the key principles we can include for us in the development world when we are designing these climate finance projects to make sure that they're inclusive and they address issues of ethics and equity is including the communities from the discussion of the project. The moment you say you want to do a project in region X, before you think what kind of interventions can we include there, just go and spend some time with the community. And how you spend time with community is also a very interesting aspect, because never go to the community and spend time with them where you are the experts. Go sit down, open up discussions, and pay a lot of attention and listen to what is being spoken. And these communities do have a lot of lived experience that we can learn from when designing these projects. Also, when the resources are mobilized, make sure you allocate enough funds that goes directly to these communities. Some of the transaction costs in these projects can be as high as up to 70%. So as lead institutions, we need to think, how do we reduce those transaction costs to make sure that most of the money goes to the communities. Issues of transparency are quite tricky and interesting one. I would challenge anyone in this forum to go and look at any climate financed project that has publicly put how they use the resources on, to see how much money flew to the communities and how much went to the transaction cost. So there is also need to establish systems to measure and report impacts. Again, in the development world, we run this project for 5 years. 3-5 years. If you go further, it's 10-year cycles. But what happens after the funding is over? Most of these issues of stranded assets across this continent is a big issue, and we have to think about how do we invest sustainably and for a long time resilience building initiatives. I just wanted to share quickly a case in Burundi that demonstrates really why climate finance is so critical. When we were doing this project in Burundi, the government of Burundi had invested around $56 million, and this was a loan to the country to rehabilitate irrigation schemes. But within 2 years, because of the flooding and erosion, this irrigation scheme was operating at 50% capacity, which meant in 5, 6, 7 years, the irrigation scheme would be totally destroyed. And the irrigation scheme was supporting hundreds of families and communities to grow rice and also for economic benefits. So when we looked at these and we were working with international organizations to design a project for Burundi, one of the issues that the project design team wanted to do was to make sure that the access roads for the irrigation made climate resilient. But when we went to the community and talked to the community, they said, yes, the roads are important, but if we have no irrigation and food to transport, then we actually have no need for the roads, which actually forced us to change the intervention from creating climate resilience infrastructure to designing a project that supports our farmers in the upstream to do better soil and water conservation. So when you talk to the community, you might have a very different project, and they give you a very good perspective on how to do this. So again, issues on stakeholder engagement, I think is very critical. When you're doing climate finance, this is one of the requirements, but how do you engage the stakeholder in a meaningful manner? If you go to a rural community in Africa and you want to engage the local communities, and you go there as an expert, in most cases, they don't tell you everything. But if you go and embed with the communities, spend some time with them when they're having dinner, when they're going to their churches, and really listen to what are the real issues, you're likely to come up with a project that really addresses the real needs and that is targeted to the people that want to benefit from climate finance. So some of the strategies of embedding equity and ethics in funding, one of them is developing inclusive funding guidelines for organizations working in the development space. We should have very clear guidelines on how to develop these proposals, and that should include a deep engagement with communities. The other aspects in that guidelines can be looking at vulnerability of these communities. Who is the most vulnerable? Why are they vulnerable? And how can we reduce this vulnerability? And more importantly also is ensure that we have a third-party monitoring and evaluation. The monitoring and evaluation that is currently common in the development organizations are M&E systems to report to the donor. But we need an M&E system that also reports back to the community, saying we were able to mobilize $10 million on your behalf. This is what we did with it, and tell us whether this is true or not. And kind of closing that loop of NME is quite critical. And then also looking at issues of long-term capacity building for sustained impact. Again, we have this 5-year cycle of projects. If you go back 10 years, in most instances, the communities have gone back to where they started. So in conclusion, ethics and equity are quite important in achieving climate and health resilience. And we need to develop guiding principles to ensure that resources reach the most needed or the most in need communities. And we foster accountability both to the donors and to the community we are working with. And I believe together we can build a future where fairness, justice, accountability is core to what we do. I'll stop there, Ravana, and thank you very much.
Hello, I don't know if you can hear me. I think there's a bit of an internet challenge with our co-host, but I'm sure she's going to join us back soon enough. At this juncture, maybe I'd like to invite any questions or comments based on the presentations that have been made so far. We've heard from our keynote speaker, keynote topics. We've also looked at some of the case studies that pertain to transdisciplinarity and funding in Africa. And we've also heard from our esteemed panelists. So just giving an opportunity to the floor at the moment. If you have any input, questions, comments, I think this is an opportune time to share those with us as we seek to wrap up the session. So any questions or comments to our panelists or deliberations from the discussions that we've had? If you could just raise your hand, I'll be able to give you an opportunity to address the plenary at this point. So any questions or comments are welcome. I think as we wait for the input, perhaps I'd like to direct and ask. Yes, Raymond. Please go ahead.
Yes, thank you very much. Can you hear me?
Yes, you can. Go ahead.
Yeah, thank you very much. Thank you very much. I'm Raymond. Can you hear me?
Yes, we can. Go ahead.
Yes, I have two questions. One is for a colleague from Work Trust, Africa CDC. From the Welcome Fund, I got presentation. I want to have a question in relation to sustainable financing for climate and health. Yes, you have to give all parameters to engage better in financing, but from your view, what could be sustainable financing for climate and health? Many of us and countries next week are roping to Azerbaijan for the COP29, and we're not sure about the financing for climate and health in these frameworks, and we're pushing for that in relation to the fora. But what would be your suggestion that sustainably to make the health sector climate resilient? What could be those sustainable financing mechanisms you think could be put forth, especially for negotiators from especially the Africa group of negotiators and other countries that are sloping to Azerbaijan? Thank you very much. The other one for Dr. Arimi from CDC is in relation to, I appreciate the ideas put by CDC, especially on strengthening partnerships and collaborations. That's strategic partnerships. That has been a missing link. And I think working together would be with stakeholders, especially state actors like ARIN and others, would be a game changer strengthening strategic partnerships. But the one question I have in relation to data, how do we ensure that we have data that is generated locally, and what can Africa CDC support Africa governments to ensure that there is local generated data on climate and health, and that data is owned by governments and they are put as part of the FOA in their NDCs. So what could be your views in relation to CDC supporting governments? And I believe as partners, we can work together on the same. So this is of data, much of the data we have, it is from the global north by agencies, universities, and research agencies on the African soil. But we have little locally generated data on climate and health. The other one we have is space mill, but how to strengthen, what can CDC help in ensuring the African government generate adequate data to influence planning, the data on climate and health and research, and help us to ensure that we have information to help us advocate and influence the processes, both at national regional and global level, especially the climate change processes. Thank you very much, and look forward for your great. Thank you for presenting. Look forward to sharing those slides. Thank you.
Yeah, thank you so much. I see our co-host is back on. Perhaps you can have those questions be answered. I don't know if CDC is still with us, Dr. Limi. To tackle part of the questions, and any of the panelists, I think, is welcome to sort of chime into the aspects of African data and sustainability when you talk about funding in the climate change and health. So that, I'd say, is open to the rest of the panelists as well. So if you're still with us, kindly, you're welcome to sort of unmute and chime in. Perhaps I'd like to nominate George Waniki. Sorry to put you on the spot for that, as our esteemed panelist, to just chime into the discussion. Yes.
Yeah, thank you, Leah. In terms of sustainable finance, I find that to be a very tricky question because sustainable finance, the word sustainable in finance becomes complicated. How can we ensure there is a steady flow of finance in this space? And I think partly of that is to make sure that in the COP negotiations, that the African group of negotiators really push for not an establishment, but the development of a special kitty, whether it is within the UNFCCC financial mechanism institutions, this is the GEF, and also the GCF, to make sure that there is a project or a dedicated fund that tries to address issues of climate and health. But again, thinking about it, maybe there is no need for that because GCF already does have huge components of financing climate and health, but also bringing in other foundations. I think issues of climate and health has been, the most part, been ignored for such a long time. And maybe it's time, and I like the question that he was asking about data and making sure we have enough information that then can entice other foundation and philanthropies to also dedicate some of their investments into this space. So that would be my best shot on that question, although it's a tricky one. So thank you, Leah.
All right. Thanks, George. I don't know if we have any other panelists who sort of wants to chime into the discussion. The questions on sustainability and African generated data, which is one of the transdisciplinarity tenets that you're talking about. Any other questions from the plenary? This is your opportunity to contribute to the discussion. If you raise your hand, we'll give you an opportunity to address the plenary. All right, so I think having said that, I'll just look briefly at the comments and just thanking many of you for joining us. There's a comment on the need to have a disaggregated data analysis. I think this was a point of emphasis by Marie Rariere. Perhaps if Marie, you're still with us and would like to expound on that point, you're welcome to do so at this point. But she's basically saying that there's need to have this type of data to enable us to gauge the gender and age analysis and to understand the situation of specific sections of targeted community. And this was just from the presentation, I think, that we had from Uganda, so which was very useful in the Muhereza presentation. So having that data aspect, I think, is very key in the work that we're doing under climate change and health. Muhereza Duncan, you can go ahead.
Yeah, I think I had a question to the presenters, especially those ones who have presented on climate and finance. Yeah, my question is about involvement of the young people. Because African countries, of course, the big population is the youth. And these are people that should take active participation in climate action. But of course, this climate finance, accessing it has processes, and of course, which most of us, the young people, may not be aware of, or even not maybe complying and so on. So my question is, how do we make sure that these young people access this finance, especially to have innovations, but also to take active participation in climate action?
Very interesting. So the question on the youth, which I think one of the panel discussants referred to them as the nucleus in the climate change and health discussion, and even in the climate change discourse overall. I think I'd like to direct this ask to Dr. Atela, if you're still with us. Perhaps you can help to address that, the aspects on youth and what they can bring to the table. I know the Africa Research and Impact Network has really tried to incorporate that perspective, but we really need to evaluate and analyze what value do they bring to the table at the end of the day. So I don't know if Dr. Johannes, you can help address that, if you're with us.
I think, Leah, thank you. In the interest of time, I would think that there are two elements to that question. Number one is, what is the preposition of the youth? I mean, one of the preposition of the youth is that they're demographically majority. And so there is, a very strong energy there that can be harnessed for climate change and health action at different levels. But also because our youths are actually working in different contexts. We do think that, especially from the work that we do at ARIN through the Capture platform, we do think that a lot of the innovations are driven by these youths, and they are in different spaces of actions in organizations at farm level and at different contexts. So we look at the opportunity in terms of the youths being able to mobilize innovations that then can be profiled and made visible through some of the platforms that are emerging. And through visibility, then funding can be really aligned to those particular innovations. But finally, I want to just challenge the youth really to be strong and be very intentional in terms of what they bring to the table. For a long time, there has been claims, especially by the youth, that we need to be included, our voices need to be heard, we need to be part of the agenda, which is all good. But the big thing is, or should be, what is it that the youth is bringing to the table? What's the value proposition? You are a youth group, you are a youth alliance. What is the value proposition that you bring to the table, so that you don't come to the table just saying we need to be incorporated, we need to be heard, but you come to the table to say this is what we offer, these are the innovations that we think can work in different contexts for different groups and all that. So that voice is quite tangible. And through ARIN, we try to enable that. We have a scheme called the Small Grant Scheme, where we try to make visible our young youthful researchers, so that some of the impactful work that is happening or they're doing in different African contexts can be made available, or can be made visible in the funding space for that matter. And I think that is quite a game changer in that perspective. But even making the youth themselves, or the young researchers themselves, being more visible to the world of knowledge in that sense.
All right. Thank you so much. So what do you bring to the table? And I think I'll just read Marie's comment chiming in to say that youth engagement is critical, which we very much agree with. That Dr. Teller has highlighted that the youth can bring innovations that support some of the projects that we're talking about and bring on board the transdisciplinarity that we are focused on. We need to be strategic about engaging them. So what is the value proposition at the end of the day? I think I'd like to hand over to our very able co-host as we wrap up this very useful conference. Over to you, Lavender, if you can hear us.
Thank you so much, Leah, and sorry for that hiccup. I had some accident, and yeah, I'm back. Thank you so much, everyone who really made this possible. I really don't know if there's anyone I'm leaving behind for the Q&A. Right, there being no any other, I'll welcome Dr. Aoko to synthesize the key insight from all these sessions that we've had from the first day to the very last day today. And finally, close for us the 4th ARIN International Conference. Aoko.
All right. Thanks, Lavender. I'm back again this time as the synthesizer of the information, but I won't take long because this is something that we have done recaps every single day from the first day of the conference. So perhaps I'll just focus on the key points that we've had today. As introduced, my name is Leah Aoko. At the Africa Research and Impact Network. I'm a lawyer by background and also a social researcher. So really excited to have all of us join us today. I know it's a Friday and anything that is well attended on a Friday is a huge sacrifice. So really thank you for joining us and making time to chime into the discussion. So today, basically, we were focusing on strengthening the funding opportunities for transdisciplinarity in the climate change and health discourse. And we've had amazing presentations, really insightful, looking at how can we leverage on funding opportunities for the Global South specifically. We had speakers from funders, implementers, stakeholder engagers as well, people who are doing work on the ground and they're able to showcase what they're doing. We had panelists who are able to give their very useful insights and comments. I know some of them have since left, but their words remain with us and we'll be able to synthesize that in a report and share the presentations as a number of you have requested. So really, the call today has included the need to rethink transdisciplinarity and for us to look at it innovatively with relevance to policy in the climate change and health aspects, to have inclusive projects in the climate change and health area for them to be relevant to what we are trying to achieve for funding models in climate change and health to be flexible, to have to be of quality, to be excellent would be very key. And I think one of the speakers rightfully said that bad writing can kill good ideas. So this is just a call to us, even as implementers, that we need to ensure that whatever we're putting out there to be funded, whatever funding models we are looking at, whether it's from a stakeholder engagement perspective or a community-based organization or a non-governmental organization, for them to align to, one, the needs of the vulnerabilities that we're trying to work with, but also the requirements by the funders who very categorically stated that during their presentation today. We also looked at how political goodwill is very critical and crucial in this discussion. We saw examples from COP28 where leaders actively engaged in negotiations, and these are ministers of health. And this shows you something, that there's growing political will in the discourse around climate change and health that we can leverage on from the Global South perspective, so that we can have projects that are sustainably funded, projects that speak to the needs of the vulnerable populations that we work with and who face the devastating impacts of climate change every day. We also see how there's need to diversify our funding opportunities. So whether it's through locally led financing, I think, is an aspect that is growing in the discourse as well, whether it's through financing at the national government, whether it's through public-private partnerships as well. There's crucial need to diversify our funding options to ensure that these challenges are being tackled not only at the national level, but also at the community level. So just again, a point of emphasis for the need of justice, equality, and ethics. Speaking of ethics, especially for the organizations that are seeking funding, there's need to ensure that there are structures for integrity. One of the funders ably quoted and said that, you know, when you get bad reputation with one funding organization, then it's most likely that other funding organizations are not going to engage you as well. So there's really need from a Global South perspective to ensure that as we get these funding opportunities, we have put in place structures for integrity, so that you're able to achieve that sustainable funding mechanisms. They need to ensure that we have climate resilient health systems. And this was a point of emphasis from the Africa CDC, who rightfully pointed out that climate change and health is not a single facet approach or subject matter, but it affects all other facets, other areas, whether you talk about food security, whether you talk about animal health, whether you talk about human health, and they have done this through the One Health approach, which they elaborated on and really insightful. And this is to address the extreme weather events, because we know that this will not stop, the flooding will not stop, the droughts are not going to end anytime soon. So we need to put in place strong mechanisms, including partnerships, relevant collaborations with government and non-government entities, with the local communities, them coming up with solutions that will then drive change, solutions that will drive positive impact for them and their people. There's also the question, I think, that was raised on the role of young people and them being able to come up with very innovative aspects. One of the panelists also ably stated that whenever you want to come up with a proposal, just look at the problems that are directly affecting your community, and you'll be able to come up with relevant solutions that will speak to their vulnerabilities and will be purpose-driven. So when we talk about funding, we're not just clamoring for where the money is. We are also saying that we want this money to be directed towards relevant projects, relevant interventions that will strengthen the resilience of this community and that will lead to a climate resilient health system through the One Health approach, which would be very, very key. So just to leave us with 5 core principles that then underline all these discussions. And one, it's on transparency of our approach towards transdisciplinarity funding. It's on sustainability. What happens when these 9-month, 6-month projects end? Are we able to sustain the impact to our local communities even after that? Accountability, having strong systems of integrity such that we can even attract more funding towards the interventions that we're aiming to do in the Global South. Accountability, not only to our donors, but also to the local communities, ensuring that the funding trickles down in a significant percentage to the communities that are directly affected by the impact of climate change is going to be very critical. Proportionality, that funding is given in proportion to the needs of vulnerable populations and vulnerable groups is a critical aspect, not only for us as implementers, but also for the donors and the funders in this question. And finally, inclusivity, that everyone who is supposed to come to the discussion is included and is engaged, whether at the national, subnational, or at the community level. That would be extremely important. So I think that's just a brief synthesis, and also just to say that this discussion does not end here. We are going into the COP29 in Baku, and for those who will be engaged, we wish you well, but we also want to see how can these discussions be escalated even during and post COP29? What can we borrow from them? And as mentioned by our director, we'll have a report at the end post-COP, and we want to see how this conference and the points that we will synthesize through our panelists and our keynote speakers and our esteemed participants right here, how this is going to influence the next steps post Baku in Azerbaijan. So from the Africa Research and Impact Network, I think I'll just hand back over to our able co-host, Lavender Ocheng, to close the session. Thank you so much.
Thank you so much, Leah. Thank you. Thank you. I'm really grateful. And thanks for those amazing insights that you've put there. They're really insightful and very direct. Okay, at this juncture, I really don't know if there's anything we're leaving behind. Otherwise, I officially close the conference. Bye-bye.
Are we having a photo?
Oh, sorry about that. Let's just turn on our video for a camera or a photo session, if you are comfortable, that is. Yes, because we will have to disseminate this out there to show the world that we had our conference.
We need evidence.
Yeah. So kindly, let's turn on our cameras. Gogo, you can help us do the group photo, or in case you are in a position to. Let us know when you're ready so that we can give a very bright smile.
Just more cameras on. Patience, Michael, John, really lovely to see you. Zaveri, Antoinette, Malachi, Catherine Vuchalava, really lovely to see you staying with us till the very last day. Patience, John, Michael Nzunga. Yes, I think we will be ready when you are. Just tell us when the photo has been taken. Nice to see you, Catherine. Thank you for staying with us till the last day. Thank you, everyone, for joining us till the last day. All right. All right. Thank you so much. Have a great Friday, and thank you for joining us.
Thank you.
Thank you.